that we do need to take minutes.
Yes.
Okay. I have to click on OK to recording. So it's an interesting question about minutes, because normally minutes only have to focus on like roll call, who's there, and action items. And so primarily this will be discussion. So Joe does a pretty decent job of trying to capture them, but we don't need, we're not going to take any action items. So
No, I'm just need to record what's you guys say and do and stuff.
okay, that's my understanding. So we have 4 of us, and Allison Towns was going to join us. Joe, do you have any?
Here she is.
Well, here she is. Good. Welcome, everybody. Welcome, everybody. I just wanted to make some opening comments, and good to see you. Good to see you, Danette and Connie. So the agenda was sent out to you. I hope you have that in front of you. The only thing that I forgot is an adjustment on that. After our period of introductions, we'll may take a break before we get into item, I think 7 is on the behavioral health handbook. Emmy and Connie are here at our invitation, and after that's done, we can take a break, and then we can carry out our general orientation as a board. And Tim Ash and I will be doing that. So quick opening, some comments, and then we'll get through them. This is a discussion time, and so please feel free to ask questions or as we go through things. Tim Ash and I are going to try to balance between making sure we get information to you and wanting you to ask questions and discuss matters. So we do have things we want to share with you about our structure and how we do things, but we want to be open to a lot of questions. We don't want to go over things that you're not particularly interested in, but so that's our balance. We're trying to do that. So maybe it's one other thing. After the break, I'll be focusing on the structure of meetings and how we run meetings. And Tim Ash will pick up some more on the structure responsibilities of members, committees, and things like that. So let's get started. I put in 3 kind of bullets for us just to kind of frame our sharing. And please feel free to add your own thoughts on it. This is often a valuable time. All of you have been interviewed by Tim Ash and I, but few of you have actually spent any time with each other. So I'll just get started by introducing myself. Tim Doty, and I've lived in Humboldt County about 22 years. I got involved with the Behavioral Health Board some time ago. The primary issue I'm interested in is general supportive housing for people with serious mental illnesses. And along with that is the kind of spectrum of a treatment and a place where people can go for more treatment than simply that. And so I'll back up on that. I was a member of the board for a long time. And then I felt, because of my concerns, I wanted to go back to the Arcata House Partnership. I live in Arcata, and I've been with them in various homeless services for about 20 years or more, because they had the only ongoing program for Housing First. And if you know anything about Housing First, it was the model adopted by Eureka City and Board of Supervisors, but been a huge struggle to implement. I went to their first annual conference, and the details are important to me. So they had what they call Apartments First, and that's about a real wraparound services. So I spent time with the social workers and people on staff and with the board about how that worked. And then I felt like in talking to them that my heart is really on general mental health services. And I mean, part of it also, I felt that they weren't providing the kind of supportive services, the case management, having someone like an LCSW to train people to deal with things like a psychotic break or things like that. So I'm back on the board, and I came back here because we had struggles getting a quorum. And then we had struggles the executive committee, and Tim Ash, I feel, has been like the chair for like 15 years or so. He's kind of, I know it's not accurate, but he's shouldered the responsibility of running our at meetings, and he I'm not sure he tapped out, but he ran out of time to keep doing that. So I agreed to be the chair of the board. And so that's kind of how I got to be here. So who would like to go first? Debbie, can I ask you, and then others can jump in and share?
Sure, Tim, let me unmute. I did unmute. So yeah, I'm Debbie Hartridge, and why am I on the Behavioral Health Board? Well, my involvement with mental health really comes from a family person's perspective. I have a daughter who was diagnosed with a psychotic illness in, a long time ago, 20 years ago or something like that. And so I just happened to hear about NAMI Humboldt, luckily, because it really helped me so much to be with people who understood what was happening, because I didn't understand what was happening. So I joined NAMI at that time, and that's National Alliance on Mental Illness. And it's largely family members involved here locally. And that's how I know Tim and Tim, both Tims. And so every year, well, Tim Ash, as long as I've known him, has come to NAMI Humboldt to our board. And I've always been on the board. It's like one of those things you join and you stay, or a lot of people do anyway. And so anyhow, every year Tim Ash would come and say the Behavioral Health Board has, we need people. And I would always think, well, I have plenty to do. I'm not going to do that. I guess just lately, what really got my attention was the implementation of Laura's Law, which my husband and I both spoke in favor of that law being implemented by Humboldt County to the Board of Supervisors. And I have read about it and, know a certain amount about how it works. And it seems like something worth a try to us. And so that kind of got me thinking, well, it would be good to be on the Behavioral Health Board and then see how Laura's Law is going, learn more about it, and hope that it does have some effect in Humboldt County. It has great potential, I think, to help at least a certain number of people. So Laura's Law was kind of the issue that made me think that I was interested in the Behavioral Health Board. I guess as far as personally, I grew up here, and I worked for Planned Parenthood for many years. And I just also happened to work at a rehabilitation facility called Redwoods United, which no longer exists, but I don't know if anybody but me remembers it, but it was located out in Manila, and we had all kinds of clients there, including those with serious mental illnesses. So ironically, I later found myself with a family member in that situation. And my husband, Ira Blatt, who I met, after this particular daughter of mine was about 13, and she was going strong at that point in time. She was looking towards a bright future, as many people who later developed seriously mental illness have that same life story. Anyway, when he met her, she was, going strong. She was a great kid. And he happened to be an attorney whose one of his focuses was dealing with Social Security disability law. So he was, at that time, he was like a resource for the public guardian, and especially for family members and people with serious mental illness. But But he was also called upon as an expert about Social Security disability law from time to time. And, you know, none of you were probably old enough to ever have had him come and speak to your group, whatever. He did that for one thing, but it was just sort of ironically later on when it happened that we were facing a situation that was a huge surprise to us. He knew a bit more about it than the average person, which was helpful and has been helpful over the years, just that he had many clients with mental health disabilities. So both my husband and myself are very interested, and I guess that's what I can say about my background. I have as far as NAMI Humboldt goes, I've just found a community there. I have worked on various projects that we've had over the years, including we did this community presentation about the conjunction between mental illness, and criminal justice system. And we had various people speak. We had a panel discussion. Mark Lammers was on the panel for one thing, and the public defender. We got lots of media attention at the time. And so I'm interested in advocacy in that way too, just drawing people's attention to what the issues are. And I will stop, and there'll be more to say later, I'm sure. And nice to meet you all.
Thank you. Thank you, Debbie. I didn't say that I am a member of NAMI, and I became involved because serious mental illness is in my family, my daughter and my brother. And that's a lot of what got me involved. So I'm just going to go across my screen and—
Hey, Tim,
Yes.
before we go any further, I was just wondering if we could ask people as part of their intro to just talk a little bit about what they hope to get out of today's meeting.
Out of today's meeting. Well, okay, let's see. Where are my notes? I have notes. I don't know out of today. I mean, out of today's meeting, I hope to develop a little bit working in the direction of a working relationship with people. Just knowing where people are coming from and their experience and their background is helpful when you're working with folks and you only see them once a month. And so that's, I guess, what I'm hoping to do, just to be able to be more effective as a board member by knowing something about people who are on the board. And I actually, Tim Doty, I've known you for years, but I didn't know quite some of the things you said today about, I knew you were interested in housing and knew a lot about it, but that was good information. That was helpful. So that's mainly it, I think, Tim. Maybe knowing what kind of issues people are interested in. And I'll have to just throw in, I think maybe that's part of this intro. I forget how the agenda is going, but I'm really interested in Laura's Law. I'm interested in services for those with the most serious mental illness, because I've certainly been through many experiences in that regard, including inpatient treatment places in various states, because my particular family member has a way of taking off, disappearing, which I laugh, but it's not funny. And finding herself in Massachusetts, Washington State, and so on. So, so serious mental illness, and also, I think perhaps that more could be done to involve parents in treatment. I think data exists that shows that's generally a helpful thing to do. And so how to do that has been a constant, I know it's kind of been a constant theme for NAMI folks. And so that is an interest that I have. I could say more about it, but I won't go on.
Thank you very much. And thank you, Tim, for bringing that up. As part of the reason we have this is get to know each other, where you're coming from. And so I'm going to go across my screen. Laura, would you like to join in and introduce yourself to us.
Hello, Laura Montagna. I am interested in advocating for those most vulnerable, the ones without a voice, by understanding the systems that can possibly help them, and becoming a translator, if you will. A lot of times in my being with someone with mental health issues, they throw up their hands when they say, we need your beacon number, and then we need your other number, and then there's just frustration. So that is my interests, and being a translator for all, both ways, the mental health clinicians as well as the patients. My goals are to start and complete as many ad hocs as I can in the next year. So mental health and incarceration, Laura's Law, interested in day use centers, sobering centers, how we can make that happen, board and cares, and educating or finding out what the education level of mental health workers is on anosognosia, which is when you're dealing with someone who doesn't know that they have an issue. And so I've been doing some education on that. And what I bring to the board, my hope is always to bring a positive attitude, a desire to learn, my documentary skills, filmmaking skills, and research skills regarding that. Thank you very much.
Thank you, Laura. And then what are you hoping to get out of our time together today?
Today, I'm hoping that we can get some fired up people to get on some ad hocs and start working. I notice over the years, I've seen, the monthly meetings are great, and I want to get some work done. And so I'm hoping to team up with people and make that happen.
Good. Thank you. Thank you. Colleen, would you like to jump in at this time?
Well, this is fun.
Yourself.
In my past life, I was an adult/geriatric nurse practitioner. And early in my nurse practitioner role, I was in a consortium of doctors and nurse practitioners who covered nursing home patients in Phoenix. We had a very large number of facilities. In that role, I was very fortunate to work with an excellent psychiatric team and a number of psychiatrically prepared nurse practitioners whom I absolutely adored. And I loved working with them and the interventions that they staged. Later in my life, I moved on to be a primary care provider in a VA clinic that was very rural, Safford, Arizona. It's a town area just about like our area, quite low census and somewhat service deprived. So I was the front end of receiving veterans. It was a veterans clinic with all kinds of issue, post-traumatic stress disorder, substance use disorder, depression, anxiety. And so I was the front face of where these people intervened in the system. And again, was very fortunate to work with the hospital in Tucson in their psychiatric and behavioral health departments. That engendered in me a deep sense of wanting to be an advocate for people, for mental health in especially isolated areas. And for a number of years served on a board of an NGO there whose primary purpose was job development for disabled or mentally impaired or ill high school kids who graduated and had no job skill, service, or follow-up after they left high school, and learned so much about the families, the stress on families, and the beauty of really seeing some successful programs start for those post-high school kids. In my current life, which is retired, I have worked in a number of homeless projects, both here and also in Arizona, where I came from before. But the sensitization that I received over my various professional experiences was wanting to be an advocate, deep advocate for the street folks and other folks in our community who had really hit the bottom and had very little access to services. The primary thing that I love about working with that group is I have seen the skill sets that they possess to survive. And I cannot state loud enough and clear enough that if the bomb drops, I'm going to that community because they know how to live. They've got it figured out. But on top of that, I've kind of been dazzled by the variety of the skill sets they have, whether it's art or music. And I also am very interested in seeing that there are some strong leaders in that community and that we need to find those folks and help develop skills and give them resources so that the street people know the best ways to take care of their interior community. And some of those communities are very strong. So I do my current volunteer work through Cooperation Humboldt and just enjoy the heck out of it. But I'm really wanting to see out of this program a way to understand what resources are in the community, to ally with those resources. And Laura, to your line of thought, do some active work in an ad hoc committee about this. So, gosh, I'm kind of all jazzed up about this and I'm glad to meet y'all.
Great, Colleen. Is there something particular you want to be getting out of today's time together?
I want to get to know you. I want to broaden my vision of what the services are or could be. And then I want to get going.
Okay, great. Thank you very much. Isabella, oh, you have a hand about something? Oh, okay. Well, would you like to share at this time? Introduce yourself to us, Isabella.
Sorry, it was my dog.
Okay.
Very needy when I'm, otherwise engaged. So hello all, good morning, happy Saturday. My name is Isabella Waterspoon. I usually go by Bella. I guess a brief bio, as succinct as possible, but I'm not very good at that. I'm Humboldt, born and raised, technicality. So I have very deep roots in this community. Both my maternal and paternal sides of the family hail from here originally, though I was raised by a very large brood growing up, very diverse backgrounds. Both sets of grandparents were first generation immigrants, my paternal side being Italian, my mother's side being Mexican. And I was raised in a very unique childhood. My paternal side ran an oil company and an Italian restaurant that was a pillar of our community for almost 60 years. And my maternal side actually ran several assisted living facilities. So growing up in that environment with a lot of elders who, counter to my own cultural upbringing, had been neglected by systems for a very long time. It was just such an awakening for me, even as a young child, to have so many elders around me that really were like an extension of my already very large family. And my grandparents did that for close to 40 years before retiring. They operated homes in both Eureka and Fortuna. And so from a very young age, I had a penchant for people and a passion for just taking care of others that had been neglected. So I, did the school thing, went to HSU, had an emphasis in philosophy and was, intending on going to doctorate school and teaching people about the meaning of life, and had an existential crisis, which was pretty fitting given my course of study. And sooner rather than later, I found myself working in positions that were in the field of social work. And that's about 10 years ago now. I've got a pretty solid decade under the belt working for a myriad of entities, serving our sovereign nations locally. I've worked for nonprofits and county affiliated agencies. And so in the midst of the pandemic, I was hired as, I really landed my dream job, a job I applied for and didn't think I'd ever get. And I'm now the first in-house social worker at the Office of the Public Defender. So despite my, vast array of experiences in serving specific populations, anywhere between youth and families to TAY youth to elders to individual adults, I found myself in an environment that I was not altogether familiar with. Working in a law office as a social worker was definitely new to me and also new to the attorneys and the staff. But it had long been a dream of my office, just given the specific population that we serve. Indigent clients oftentimes face unique barriers. Not only are they overwhelmingly houseless, they face challenges with regards to severe mental illness, substance use disorders, but they also have a unique barrier, which is criminal history. And that oftentimes proves, astronomically difficult with regards to accessing services on their behalf, because they can be discriminated against. Serious violent felonies stay with you. And, if you're on probation or parole or supervised release, there are a lot of other responsibilities to ensure that you are not taken back into custody. And it's a very real fear that most of the people that I serve, have to struggle with. And, getting started in the middle of a pandemic when essential services were all but inaccessible, due to the public health and safety concerns that COVID initially and continues to persist in, making us face, I suppose. Getting our most at-risk and vulnerable clients access to things from mental health care to medical care to housing was a real challenge, compounded alongside the fact that I was building a program from scratch. And so that was about 2 years ago now. I'm starting to get in a groove, and we're really starting to get an idea of what, thankfully, with new programs in development, like our mental health diversion, has been key in diverting our clients with severe mental illness out of the criminal justice system and into more appropriate care. And I would really love to see expansions of those types of services, because oftentimes in this country, it is a national ongoing epidemic. Ever since the decentralization of our mental health care system, our criminal justice system has all but adopted the vast majority of our most at risk and vulnerable individuals in this country that are committing crimes, sure, allegedly, but there are pre-existing conditions to those crimes. And the overwhelming majority are poverty, houselessness or housing insecurity, severe mental illness, coexisting substance use disorders, and basically a failing on the systems as a whole. because if these people had encountered, had received some kind of outreach, had somebody to step in and intervene sooner, they would not be in an institution. And so, obviously I feel very strongly about what is lacking both on a national and on a local level. Like I said, this is not just an issue that Humboldt County is facing: lack of resources, lack of access, lack of advocacy, lack of services on the whole. This is really something that our country as a whole is dealing and grappling with. And, I see positive change and positive movement both on our local and national and state levels. And part of my reasoning for joining this board was not only to further my own personal education, make me a better advocate on behalf of the clients that I serve, but also to get a better idea of where we are at now and where we need to be in future. Because if these institutions and services were created in hopes of serving our most at risk and vulnerable, and I see, unfortunately, time and time again, they're not making that connection, then what is their purpose? What is their what is their goal? And so that's kind of where I'm at and my whole philosophy. And I suppose what I want to take away from that today is just to, open myself up and introduce myself as succinctly as possible, which that wasn't very well done on my end. And also to learn more about y'all and what brought you here. And I would also like to end by saying that my sister social worker, Conflict Counsel, our sister law office, has recently acquired, thank goodness, a social worker of their own. And so I would love to offer a platform for Miss Dawnette Kellerman. She is here, I believe. And she is also interested in becoming a board member as well. And I just want to make sure that she's given a platform to introduce herself, because we're both breaking ground on our end. She is also the first in-house social worker over there, and we are a unique thing that this state of California, specifically the BSCC, this Indigent Defense Grant that our office was recently allotted, is furthering our funding for our attorneys and our law offices on the whole to have in-house social supportive services available. Because as I stated previously, historically, that's the population that the Office of the Public Defender and Conflict Counsel and basically any other public defender's office in this, it's a very certain subset of socioeconomic clients. Because obviously if you're well off enough to afford a private attorney, you're probably off enough to have housing and access to medical and mental health care and everything else that, your needs are being met if you could shell out that money.
Thank you, Isabella. Can we move along right now and get some more information from other people?
I'm done.
Okay, thanks. I wanted to go to you, Joe. No, you weren't expecting this, but to describe your role in terms of the Behavioral Health Board. What do you do? What are your responsibilities?
Well, I help to make sure the meetings are scheduled, that the information is posted on the website, keep the members, forward the memberships to the Board of Supervisors. Just try to coordinate everything so the board can run smoothly and do the best it can.
Thank you, Joe. It seems to me you've had that job for a long time. How long have you been doing that?
18 years.
Okay.
I started as a volunteer and they put me right in, and I haven't no one stepped in since.
Well, you have a lot of history. Thank you. Thank you, Joe. Allison, introduce yourself to us.
Good morning, everyone. So the reason why I wanted to be on the Behavioral Health Board is for mainly community advocacy. I'm also really interested in the MHSA, like where the funding goes for that, exploring solutions in the community. I'm especially interested in Laura's Law. I did the initial research for the old mental health director back in, I think, 2012, when this county first started looking into it. So I would reach out to the director in Nevada County and have conversations with him at the time about how they implemented it. I'm also really interested in improvements to CV or CSU and SV. My goals are, like, I'm always about systems change and making things better. Systems were often designed by, people that didn't necessarily use them, lawmakers, legislators. So I like to look for ways to make things better. I'm an experienced grant writer, so I'd like to help with grants if possible, grants specifically for like SV, CSU patients there. I'm very interested in a detox center. Some of the research that I did in grad school was on the potential of a detox center in Humboldt County. I'm also interested in more data and data-driven decisions, data being made available at the board meetings so that we can really dig into things that are going on. I'm interested in helping with the annual plan and then the MHSA ad hoc committee. And I'd like one goal is to get the annual plan back to being annual. What I bring is a growth mindset, a desire to always learn more, really good listening skills, a degree in business, and then a master's in social work. I have a background in marketing, sustainable management. I actually worked with Joe in the office for about 3 years. He was great. So I worked there as an analyst. I wrote some grants there. I worked on the Behavioral Health Integration Network grant. I worked on AB 109, the implementation of it. Then I went over to public health. I worked on, in terms of mental health work there, I worked for the Postpartum Support Network, which helped, providers that were serving moms going through postpartum, which was about 1 in 4 moms throughout the nation. I also worked as the fetal infant mortality and child death review coordinator there. So worked at the coroner's office and went out to the hospitals and reviewed health records all week long. After that, I went to economic development and felt like it was a little bit more upstream, helping people with barriers get jobs and write grants for them, just to help out the overall community. I worked on an opioid grant there, which was like one of my biggest grants. And then prison to employment was another one that I worked on. Then after that, I was recruited by the state board. So I went to work for the California State Workforce Development Board, and I've been there since last May. I manage the High Road Training Partnerships Project, which is funded through the California Air Resources Board, looking at the low income census tracts and helping to serve them and looking at the air that they're breathing in those areas and helping create green jobs for them. And I also have another grant through the Department of Education. What I hope for today is just really getting to know other members. I just also have to say hi to Ruth Broderick because I haven't seen her in a while and I love her. Getting to know other members, helping, I feel like I'm fairly good with the board rules, having served with the workforce board. But I know one thing that kind of annoys me is when people say I motion to do something and they really should say I move to. So just going through those rules, I think would be really good for everyone. And I can always improve on them myself. And then more ad hoc committees and more involvement. And I've tried to get involved as much as I can. I'm realizing how much time it takes. It's a lot, but I think that's a commitment that we've all made here. And I really want to see everyone step up to the table and take on some leadership roles as chairs of ad hocs. And I think that is about it. That's a lot. Sorry if I went too much. Thank you. Oh, you're on mute.
Thank you very much, Allison. You've always been involved in a lot of different things, and I'm glad you're with us.
Oh,
So,
Tim, I wanted to say, Allison, I worked with Allison. She helped put together the behavioral health handbook a few years ago.
I
She
did
was
not know
She did a
that.
lot of work on that,
Okay,
a lot of research.
that's really good to know. I did not know that, Allison. Thank you. So, Danette, you want to introduce yourself? Your name is pronounced Danette. What do you prefer?
My name's Danette. If you ever play volleyball, the ball goes over Danette. That's how you say it.
Okay, thank you.
So my name's Danette Kellerman. I am the Conflict Council social worker. I'm really nervous, so please excuse me. So I started out 26 and a half years ago, pushing a shopping cart myself. 98 pounds with orange hair, wearing royal blue spandex and white cowboy boots. And when I went to treatment, I was told that to get on SSI because I would never work. And that's where my mental health and my addiction took me. I started going to school for alcohol and drug counseling 22 years ago. I've been a counselor for more than 20 years. I've worked for Riverside Psychiatric. I've worked for Riverside Homeless Outreach, Boots on the Ground in Palm Springs, Homeless Outreach. I have worked in California State Prison. Most recent, I've worked at a lot of places. When I was working for a program in Riverside, a lot of the clients would come to me and talk to me about mental health issues, and I was told I couldn't talk to them because I wasn't educated on it. And so I went to school and got educated on mental health issues. So I'm a certified mental health technician. And then I went ahead and went to school for criminal justice. And again, the whole time I was in school, I was told I would never work in the field. For 4.5 years after I moved here about 5 years ago, and I started working for drug court. I worked for Humboldt Drug Court for 4.5 years. During COVID, I transported a whole lot of people that had COVID to get COVID testing. I set up a Zoom meeting for clients to check in with drug court. Been able to do a whole lot of stuff. When in June I quit, and I went to be with my family down south, and my sister passed away in August of COVID. My mother passed away October of COVID. And so I came back to Humboldt. And I have this job, this amazing job that, of course, you know, I was told years ago I would never work in this type of job. And I've been able to do some amazing things. One of the things that I would like to maybe introduce or talk about is the stigma of mentally ill people, the stigma of criminal justice, the idea that if somebody has mental health issues and acts inappropriately in a facility, then they're no longer accepted there is absurd. I have worked with a couple people. One of them is banned from medical attention. Like that's ludicrous to me, and I'd like to see that change. I think that from my own personal experience, I think that a lot of our people that we work with in the community, I think COVID burnt a lot of people out, and we need to learn some self-care. You know, and I'm not saying that me being mean. I think that as you know, as professionals, maybe some training on self-care is like hugely important, so we can handle our clients better. And the other thing that I'd like to, I don't know, I'd like to see improved is when people have criminal justice issues, they're expected not to commit any more crimes, yet a lot of jobs won't accept them because they have criminal justice issues. And so, like, what do we expect them to return to? I just would like to see some more education or more help when it comes to like walking hand in hand or side by side with people that struggle with even daily living skills. Like we tell people, like we'll give people referrals and say, here, you need to go there, but they don't even know how to do that. And when they get there, people act as if they shouldn't be there. And so I don't know, I've been able to advocate for quite a few people recently. And I just think that as a community, we can do better. Thank you.
Thank you, Danette. I can understand being nervous, but you belong to us. You bring a voice to us that we really need to hear. And so thank you. And it's part of our state mandate, part of our heart's desire is that everyone be actively involved, and you bring that. So thank you.
And one more thing, sorry.
That's right.
And when I came here, I started the Recovery Happens picnic once a year, and Recovery Happens in Humboldt, and it's been quite successful. We haven't been able to do it for 2 years, but I just reserved the park for September 10th. So we're going to do it again this year. Thank you.
Thank you.
So Danette, you didn't sound nervous. So you're basically wasting your time worrying about it.
Thank you.
Well, thank you, Tim Ash. Hey, Tim, you want to introduce yourself to us?
Sure. I'm Tim Ash, and I've been up here in Humboldt for 47 years. I've been on this board for 16 years. Live in Arcata. I've got 2 adult children. My wife passed away a couple of years ago, and so I'm a single parent at this point of people that some of them can take care of themselves, some of them not so much. My work experience, I've done anything from being a shovel operator and chainsaw operator for the Park Service to bus driver, planner, fish biologist. I've worked in policy and regulatory program in Sacramento for a state agency. I got into this area when a family member, I didn't have a family history, but I had a family member develop a no-fault serious mental illness at the age of 16. And his life pretty well went off the tracks at that point. But up to that point, like Debbie mentioned, her daughter, he was a smart kid. I was very successful, got along well with his peers in school. But all of a sudden things started happening, and he went off the tracks. He had early criminal justice involvement. I think that's when I really got involved, because I just saw how poorly the system was designed for people like him, both the mental health system and the criminal justice system just seemed very ill-equipped to deal with him, and for various reasons. But anyway, and I just saw, as I looked into it, I saw how things went. I saw a lot of people that didn't really, were not really well equipped to advocate for themselves. And I had, been in a bureaucratic environment for nearly 30 years at that point, and felt pretty comfortable dealing with it. And so I got involved both with NAMI and also with the Behavioral Health Board. My interests, you know, I'm interested in anything, you know, where we all can work together to make things better. But personally, I just felt that the injustice of treating people that have illnesses that come with symptoms that sometimes color outside the line, having them treated as criminals was wrong, and felt like it would be worth working to try to have this system be a little bit more understanding, empathetic, and effective dealing with those folks. It was worth some effort. So with the county, besides being on the board, I've been involved with the CIT since we started. I was kind of brought into that as a family voice for the CIT, which is, I think probably everybody knows, it's crisis intervention teams. But so I've been involved with that, and participated, just attending Community Corrections Partnership was kind of the county leadership end of AB 109, which is, you know, pulling some folks out of the prison system and, you know, having them go into the community with supervised release. And I guess I'll leave it at that. But and also had some interest with the first break psychosis, partly because my family member, you know, had a serious illness with a psychotic component to it. And as I said earlier, just the way the support that he got and my family got at that point was really not good. And it could really be a lot better. And so, you know, I have advocated for us having a full, it's a first break wraparound programs are evidence-based practices, nation, you know, throughout the nation. They're not very prevalent at this point, but it's a good idea what they do. It's just really helping people, that helping the person in New York. They call it on track New York, which they basically are taking people like my family member, and before they go really off track and become out of school, you know, not employed, and just the people that Danette was just talking about, helping them not go there. And anyway, I just think it's something that I'd like to see us do better. There's challenges, and, you know, Emmy and Kami can talk about, you know, some of the challenges in staffing and funding that type of a program. But anyway, I was just very interested in that. Yeah, I mean, I guess that's pretty much it. The comment about the homeless, I forget who said it, was Laura, somebody, whoever said that if, you know, the bombs drop and we're out living raw, then, you know, they like to be with the homeless folks. And I see that because I just living in Arcade, I see plenty of people who's around that are homeless, unfortunately, and I watch them share with each other. I've always been so impressed how they share, and because they understand that they have to work together and help each other to survive. And anyway, I've been very impressed with it. And I just wish that we could share better with them. So, what I hope to get out of the meeting, similarly to what other folks have said, like to get to know people a little bit better, and you know, hopefully help people understand at least how we're set up, and maybe talk a little bit about our goals, what our goals might be.
All right, thank you very much, Tim. We used to have, as a board, annual retreats, which allows us to include other people who aren't new members. And we focus less on introductory kind of things, but to try to look at more strategic issues. and to get that, to deal with that larger picture, and also to spend the time focusing on some things. And I certainly would like to have one of those. And I am so hungry when we can actually sit in a room together, because I think that helps so much in the work that we do. Tim Ash, did you put up another? No, I always forget when I put my pointer over someone, my hand shows up, and then I think you're raising your hand. I am so not competent in these areas. So move to our staff members who are here. Thank you very much for being with us. And I guess, I had those three general questions, but as Tim Ash brought up, as you talk about these three things, to talk about the challenges that you face in carrying out the work that's been given to you. So Emmy, introduce yourself to us.
Okay. Hi, everybody. Danette, thanks for paving the way with talking about feeling nervous. I always feel nervous when I speak in groups, no matter what, every time. And it doesn't matter if I don't sound nervous, Tim, I still feel it. So I think saying it out loud really helps me. I'm so grateful for all of you here. And I just took notes as I was listening to you talk and appreciating what you were sharing. I wanted to just start by recognizing the two Tims who I've had the pleasure of working with for quite a while now. Tim Ash, probably the longest when I came into this position, and before you were working with the board. And I just feel like we had the opportunity to really develop a relationship that I value to this day. So thank you for that. And Tim Doty, so thankful that you stepped into this role. I think I reached out to you and said, hey, would you be interested? We really need someone. And you just leaned right in. So a lot of gratitude for you for doing that. One of you mentioned what a time commitment this is. I think Allison, you did. And I just want to say absolutely true. And that's right. And the willingness of all of you to make that commitment is really appreciated and important for our community. And so just saying yes, and thank you for doing that. Let me just start with my own introduction, and there might be other places I loop back to notes that I took as you guys were talking. I grew up in Humboldt. I wasn't born here, but I grew up here, and this is where my family lives. I left the area for a number of years and then came back, and I've raised my children here. So this community is truly my community. My parents were HSU professors, and they're still here in the community. And I just, really feel like this is where my roots are. This is where my heart is. I went to HSU. I attended Humboldt State University. That's where I got both my bachelor's and my master's. And I also had kind of an existential crisis after my bachelor's, because I realized I didn't want to be a PE teacher, but I wanted to do something else in this world. And that's when I made my way into the area of psychology, and am so grateful for that. I have kind of a fun fact. When I was at HSU, some of you probably already have heard this, we started identifying our internships or our practicums at the time. And I selected working with preschoolers, which I'll say a little bit more about that. But some of my colleagues took practicums or internships with the county. And my comment at the time was, I would never work for county mental health. So here I am, loving my job, but at the time I was not interested. So I did start working with preschoolers at that time, and really that's where my my work as a provider started. I worked with little kids. I then kind of dropped even younger and did some infant mental health, which to this day I still love and value so much, because I really think that that's where the true help for our community lives. That prevention and early intervention is really where we create health and wellness throughout our community. And then I had the opportunity to just kind of move up through the age range and worked with, older kids, teenagers, young adults, and adults. And then had some really great opportunity when I left the area to work in the Bay Area and in kind of the communities in Richmond and Oakland. And that really allowed me to have a different perspective around how we support and lift up the importance of racial equity, racial and cultural equity in the work that we do, and really recognize how we support oppressed and marginalized communities, because I think that's an area we still really struggle with. Let's see, I came back to Humboldt in 2007. I worked for the courts for a minute. I was a family court mediator, which was really helpful. I actually have some interest and experience in working with divorced families, and so that kind of aligned with that work. I actually started from the children's perspective, so I was working with children who had experienced divorce. And then I worked at United Indian Health Services for a number of years as their behavioral health clinical director, and that was fantastic for me because I got to really be immersed in what do healing practices look like for different communities, not just from kind of my white perspective or our Western medicine perspective, but really from the experience of the communities that we share this planet with. So that was really a great experience. And then I came over to the county through children's. I was a manager in children's behavioral health, and then I was the deputy, and then I got the opportunity to be in this position, which, like I said, I really love. I love my job. It's probably the hardest job I've ever done, for sure, but it's absolutely a job that I love. Just in terms of the scope of what my job is, I oversee all of behavioral health, so mental health, and most of you probably have some idea of what that entails, but it's pretty vast. So inpatient and outpatient, we have med support, SV, obviously, we have crisis stabilization unit and our emergency services. We have children, TAY, adults, we have an older adults program. We have regional services. We have some integrated services and programs that I think are really great. We work in the jail, our regional facility, juvenile hall, and then we do some of the community responsive things that you're aware of, like our crisis negotiation team, our MIST program, which we're infusing a little bit more recently to try to get some more partnership with law enforcement, our mobile response teams. And then we have our SUD program, substance use programs, and we recently rolled out drug Medi-Cal organized delivery system, which really expands the work that we do and allows us to have a more robust continuum of care, because we're partnering with other local, other regionally local counties and communities. We have really fun, I think, unique and great programs there within SUD. We have our Healthy Moms program, which is children, babies, and their moms getting treatment. We have our Family Wellness Court, which is a partnership with the tribes. And so we get to support child welfare involved families in getting support that they need. We have a dual recovery program and our just outpatient SUD program. And then within behavioral health, we also have some of the social services programs that are part of our continuum of care. So APS, IHSS, Public Guardian, and Veteran Services, because before my time, it kind of was decided that housing them under behavioral health allowed for, I think, a better coordination of care and smoother transition between services. So I'm just thinking a little bit about the question around challenges, and I guess I'm going to start with talking a little bit about kind of my thinking of our relationship with Behavioral Health Board, and I think that will maybe touch on some of the question around challenges. Most of you have heard the challenges that we face within behavioral health. Staffing is one, funding is one, a really archaic payment structure that allows us only to get paid for the cost of what we do, cost reimbursement, which can be less than what we actually spend, depending on how allowances or disallowances happen. And a lot of really kind of rigidity around access to care and who we can serve and what criteria have to be met to serve individuals and to get paid for serving them. So I can talk more about that if you have questions, but I guess I wanted to just speak for a minute about my my hopes around the relationship between Behavioral Health Board and behavioral health. like I said, I have relationships with some of you, and I'm looking to have and develop relationships with all of you in some capacity. I think that's really important. I kind of came up with 3 things that are the primary ways I imagine us working together. One, I really see you, of course, as an advisory board. I think that's your role, is to advise what, behavioral health and the board of supervisors in terms of what you see the needs are in our community, what you see as the gaps. And I think that kind of goes a bit to the second area, which is really an advocacy body. So I think it really is your job to advocate for our community and getting their needs met in terms of behavioral health, so which is mental health and SUD. The third area that I really feel is critical from my perspective is that you're an ally. You're an ally to county behavioral health, and I say that because I think that that last piece is how we can be good partners and really move the work forward. I sometimes share about my concern, I guess that's the right word, around the staff in behavioral health, all of whom are doing this work because they have their own personal experience in this field, all of whom have been touched by somebody who is a mental illness or a substance use issue, and are hoping to make this world a better place for them, or to make sure that they get the services that they need. And one of the things I often say to the community or to stakeholders or in conversations is just asking for grace and assumption of good intent for the staff that work within behavioral health, because county behavioral health can certainly be seen as a government system, but it is made up of a whole bunch of human beings with all sorts of complicated experience and trauma of their own. And so I worry, I feel protective about my staff sometimes, because there's a lot of scrutiny and criticism that comes from the community around the work that we are or aren't doing. And there's a level, I think Danette referenced this, or somebody, of burnout and self-care that has to happen, because we behavioral health, we're experiencing all the very same trauma and struggle, and yet we're still the ones that have to reach out and create that support system for everyone else. And so it takes a toll, and staff don't get to say that. They don't get to say, well, I'm struggling too. That's not what they get to do, but they have to still come to the table and be present and listen and receive. And often I find myself in community meetings where people have a lot to say about behavioral health and what we're doing or what we're not doing. And I do not expect or allow my staff to respond in defensiveness or to point fingers or criticize other systems. I don't feel like that's the way forward, yet they come to the table and often they hear that about themselves. And so I'm saying this only because I feel like part of the role of the Behavioral Health Board, and I've said this to some of you already, is to be an ally and to make sure that you lean in and really understand what's happening and what's possible and what's not possible. Nobody for behavioral health is trying to get out of doing this work or trying to find reasons why services can't be provided. There are challenges much bigger than Humboldt County and much bigger than California, frankly. But I think together we can advocate for changes in some of those areas. But I think we have to do it through grace and kindness and assuming good intent. And so that ally piece is really important to me, and more importantly for my staff, because they're really good people and they're really good hearted and they're doing really good work, and it's not always easy. So that's all I want to say about that. Is there more that would be helpful for me to share in terms of Tim or Tim's questions? I'm just looking. I guess the only other thing, this is not related at all to what I was saying, but appreciating the flag or the reference around including families in treatment. I do feel like every individual is made up of a system, and the more that we can kind of wrap around that whole system and make sure that people the people supporting the people are being supported. And maybe that does kind of lend itself to what I said earlier. How do we support the systems that are supporting the people that are suffering?
Thank you. I want to take a little bit of time for any questions we have, although I want to keep us on track. One of the things come to my mind, Emmy, is that people coming to you with a very specific concern. In NAMI, we often say, well, you can go right to the director if you have a question about why medications have been deferred so long, for instance. So that general question of how much involved you are with actual programs, my assumption, you spend a lot of time in management, and all kinds of, I don't want to go into them. And so, and then you have deputy directors that do the important actual program supervision. So how do you see that the balancing of those things in your job?
It's a really good question, Tim, and I don't know that there's a set mechanism for that. So I do feel like I really empower staff at their level to make the decisions, including treatment staff. That's their job, right? That's their expertise, and that's what they bring to the work. We have an internal mechanism for issues that that clients or families or community members have concerns about, and so those can get flagged and worked, you know, up through our processes. We have grievance and complaint processes. I certainly, if somebody reaches out and says, I have worry about my family member's treatment, I absolutely will connect with that deputy or that manager or that supervisor and just say, hey, can you talk to me a little bit about what's going on, and who or how can we circle back with the family on that? So, you know, I see my role as for sure being responsive, and also hoping to empower those staff that are doing the work to do it really well, and to provide the supports for them to do that. I don't know if that answered your question, Tim.
No, I feel it did. There's always lots of different questions about that. I guess the other question is, on actual board functioning, executive committee, and being there for your reports, how do you see your role in those areas?
My reports, you mean county staff?
Well, you
Say that
report,
question
on our agenda, you have a time for making reports. I guess I'm putting two things in there, that presentation to us, and then the other one is your role in terms of the executive committee, where we often set agendas or talk about issues that the board can relook at. What do you see your role in those two things?
So to the first question about what I report out on, I bring what I think of as most pertinent. I think early on I said, give me input, because I'm happy to share if there's an area that your board wants to hear more about. And so I hope that can be a dialogue back and forth. If my reports are hitting the mark, or if they're not, then let's talk about it. In the executive committee, it's a good question. I try to just support the work of the executive committee. I give input when I have it, although I don't feel like I'm the driver of that committee. I feel like I'm a participant, and so I try to join in that way. But again, you know, I'm open, Tim, to how you see my role in that committee, and if that's working for you or not.
It's an ongoing discussion. I feel comfortable with it, but
yeah,
and that's always kind of shifting and changing. So I just want to get your general take on it. If my understanding that Connie had to deal with a personal issue,
yeah,
if you followed the chats, and would come back to us when she can, and that's what we'll do. If she doesn't get back to us right away, then hopefully we'll find another way to fit her in into part of the program. So I just want to invite any other board members, if you have some questions for Emmy about her work and her working relationship with us.
Hey, Emmy, this is not a question, but it's a comment or a suggestion. Have you ever considered like taking like 1 hour every couple of weeks and working with a really young kid volunteering at Children and Families? I'm serious, because it, you know, reconnects you to something you love to do. Even if you don't do it 40 hours a week, you can do it a little bit.
That does sound like a question, Tim, but I
It became one.
I would love that. I would love that. I actually continued doing private practice for a period of time where I was just doing that, working, providing services to little kids, and it is such a passion. It does really feed my soul for sure.
You could talk to the boss, you know, whoever
Yeah.
assigns,
Those
you know,
cases.
assigns people.
That's right. Yeah.
Thank you, Tim. I saw a hand from Laura Montagna, and then maybe Debbie wants to ask it. Laura?
I just wanted to thank you for responding to my email. And I know I ask a lot of questions because I'm trying to learn. And when I'm advocating for someone, I will always try to go through the channels, or like, hey, how does somebody get help for this issue? And so going through all those channels and then being like, this is not, like, I'm not getting any answers. So thank you, Emmy, so much for answering that email to me. And I had gone through channels, and I just hope that when I ask questions, I do assume that everyone's doing the best they can, whether it's the person on the street or the leaders, if you will. So I just wanted to say that, because hopefully my manner isn't not positive, you know, but just know my intent. And I try to give everyone the grace, like if somebody answers me sharply or whatever, it's like they're going through something, just give them the grace. So, and I'll ask for that in return. But I just wanted to thank you. I appreciate your response, and know that I just didn't go to you first, but I tried other things. So that's all I wanted to say.
Thank you, Laura.
Thank you, Laura. Debbie, did I see a hand from you or an interest?
Yeah, I had a couple of comments, and thank you, everybody, for caring so much. I see that with everyone. Tim Doty and I, this is for Emmy about your staff. We had this opportunity several years ago to be on a panel, a hiring panel, sort of. It was for student interns from HSU, from the social work department. And I think altogether there were like 12 people or something like that. I was probably there for 6 and Tim was there for 6. But it was a really great experience for me. And just in terms of being so reassuring about the quality of people that were coming in to work there at Humboldt County Mental Health. All of these people that we interviewed had some good background experience and really were very caring. And it was a nice thing to see. In terms of stigma too, I wanted to comment about how the Mad River Union has just seemingly quite recently started doing this series about describing individual people who live in Valley West and who are unhoused or homeless or whatever you want us to call it. And they did, I think that it's very impressive to me that they're doing that. It's very humanizing. And, you know, I read the last one, and so as far as thinking in terms of advocacy, I will write to the union, which I sometimes do, and thank them for taking that on. They're giving quite a bit of ink to it, and it makes an impression. Makes an impression on me. So
Thank you.
Just comments.
Thanks for that. Yeah.
I want to add a little bit to that. I was on the Continuous Quality Improvement Committee for Outpatient Services. And I think that was a time when the state was really pushing for consumers or family members to be a part of it. And for part of that time, I didn't even know why I was there. There was a lot of technical language and things, but I felt like I had a role. And simply by listening and asking questions, and that sense of having family members be a part and connected to what's happening, I found that very valuable as well. So thank you, Emmy. Connie, you're back with us. Is everything okay? And you ready to share with us? Introduce yourself.
Hopefully you won't hear screaming in the background because this is Colton's nap time. We normally watch him on Saturdays, and I love him to death. He's 22 months old, doing all sorts of really great things, and it's about his nap time, and he goes and goes, and then it's time for him to take a rest. And Papa doesn't snuggle like Grandma does, so and he's used to a certain routine. So I really apologize for that. And like I said, if you hear a little bit in the background, it's just because he's like banging at my door trying to get in or something. Hopefully that won't happen. So let's see. So a little bit about me. I've lived in Humboldt County most of my life. Born here, and I was just thinking as we were talking that I think I was actually born in the old General Hospital, which was 720 Wood Street. So right before they moved to the new hospital. My family's from here. I feel deeply for our community and all members of our community. My background and education is actually in finance and business administration. Started with the county about 26 years ago. Prior to the county, I actually did payroll in my 20s at Crestwood Manor. And part of my other job there at Crestwood Manor was conservatorship coordination. And so that was my first real experience with severely mentally ill, and working with them around their court dates and processes for them to be ready to go to other placements and that kind of stuff. So severely mentally ill folks have always been like near and dear to my heart, and have seen a lot over time around the need for other services in our community, not just through the county, but through other ways. So I started, like I said, 26 years ago in finance. After a couple of years, became the supervisor and then manager, and moved to program manager. Did some managing around general relief and all of our benefit programs. Went back to administration, became the deputy director of finance. That was probably 10 years ago. And then our assistant director of administration retired, and I promoted to that position. And then when our DHHS director retired, I was not going to apply or take the position, and I kind of ended up in the position as default about 6 years ago. I feel like we've done so much over the time. And I just like to talk about that a little bit. I feel like it's important for us to like look back at some of the things we have done, because we were able to restart mobile response. For several years, we didn't have a mobile response team. We've expanded regional services tremendously over the last few years. I have to thank Emmy for all of the work that she's done since she's been director. Part of my job, I guess I should go along with that first. We have over 100 programs within Health and Human Services. Health and Human Services, I feel, it's so important that we're integrated because we are able to provide more services than if we were siloed. We do some pretty good collaboration, not always, but we do some pretty good collaboration. We still have some areas where we could work on that a little better. But I have to rely on our experts in the areas that they're responsible for. Emmy's one of those. She does a phenomenal job. She has a wonderful team. She's built a wonderful team over the last few years. So I appreciate her for that. I did want to start out by saying I so appreciate you all being here and taking the time to, well, your time is so valuable, and for you to be here on a Saturday and to continue to do this work. It's all volunteer, and we need you, and it's so appreciative that you are here. I love the diversity of the group and your background histories. It just makes me hopeful that we're going to build an even better behavioral health board because you're all participating. So I so much appreciate you. I'm really sorry that I didn't get to hear all that Emmy shared. I will agree with most of what she says about the difficulties in, especially just only being able to bill for direct service and all of the complexities of that causes barriers in our services, and it makes it look to the community like we won't provide certain services to certain people, and it has everything to do with what we can do and the revenue that we receive. So let's see, what else was I going to tell you? Things that I'm looking forward to. I was looking at these questions, and things that I'm really looking forward to is we are starting an adult crisis residential that will provide additional services and step down for folks that are leaving Sempervirens. We are opening a children's crisis residential. We've never had one in Humboldt County. That's incredible and amazing, and it's wonderful that we have partners that are doing that work. We have an additional 14 units for permanent supportive housing for severely mentally ill coming online May of 2022. That when I became director, we had 15 units, and it was the only permanent supportive housing that we had for severely mentally ill, and that was at Arcata Bay Crossing. Since then, we've grown to 129 units. That's huge for us. It doesn't sound like a lot. I know that it might not sound like a lot, but for us to commit to, for the county to be able to commit to 20 years of providing services and care at those housing units is a really big deal, right? So very excited about that. There's other things that I'm working on that aren't quite there yet, like a navigation center for our homeless population in the city of Eureka. I'm this close to be able to really be talking about that, but I'm not able to do that at this point. Let's see, what else should I tell you? I think behavioral health is one of the more complex branches of our department. You know, it's all health and human services, we're dealing with humans, and so we deal with a lot of liability and a lot of criticism for not providing perfect and, timely services always. But I do agree with Emmy that all of our staff are absolutely committed to doing the work, and are all good people. We're so lucky and so grateful for them. We did just increase wages in the county, and so hopefully that will get additional people to apply for positions. We are working, trying to do some better recruitment and retention. I think that our work around diversity and equity and inclusion is going to be a big part of retaining our employees in the future. Our admin team has spent a whole lot of time, and we've had a group of folks, a committee of all levels of staff that have been working around that for about 1.5 years. And we just hired an equity manager to build more consistency within all of DHHS. We're also working with the county, other county departments to do some of that work too. So yeah, I really look forward to that. I myself personally, I have family members and friends that struggle with SUD and mental health. I think we all can say that we know someone. So this is all, us providing good services to the community is all near and dear to my heart. I don't know. I think I rambled on a whole lot. Is there any questions that you have for me?
Thank you very much, Connie. I guess the first one that I have to get the ball rolling on is, since the pandemic has been here for several years, it's just thrown everything in a very difficult and challenging area. So I'm assuming that you spent a lot of time with public health over the last 2 years of your job. Is that fair to say?
Yeah, yes. And public health in previous to the pandemic was a pretty easygoing branch, right? They were all about prevention and good easy stuff, right? And then the pandemic hit, and yeah, it's been a huge priority. And really, well, I think we can all agree that not knowing what the future looks like is so hard for planning. And so imagine all the programs that we have that we're like trying to plan, and you can't plan because you just don't know what the next day is going to bring, right? We're finally seeing a future of what might be a little more normal than what it's been in the last 2 years.
So a quick follow-up question. When might the Behavioral Health Board have in-person meetings?
So, because of COVID and having to have space for everyone that was safe, we've had staff in a large conference room for a 1.5 years. They've been working from the large conference room. We just are having conversations about moving.
Connie, you're kind of breaking up.
Those folks for that work.
So you're in the early stage. Go ahead.
I think I'm losing
A connection. It looks weak right now.
you. Can you guys hear me?
Barely.
Here.
I can maybe just fill in a little bit of what she's saying until she gets back on. We've had to utilize the large conference room at the Pro building on the MES level for staff because of just reconfigurations during COVID, but we're having conversations right now around moving those staff back to permanent places. And so the hope or the goal is that fairly quickly we'll have access to that large conference room on the MES again, and then we can talk probably at the executive team initially, but talk as a behavioral health board about resuming in-person meetings.
Thank you, Emmy. I'm sure other people had some questions, but we've lost Emmy. We've lost Connie. Emmy, you're gonna have to stand in for her.
Okay.
Mr. Ash, Tim Ash, what you got?
Yeah, my question has to do with salaries of staff. And, in terms of recruitment, I know you guys have thought of and tried whatever you could try, but I just, for my own education others, wonder if you could answer, if say for a psychiatrist, you decided to raise their salary $50,000 a year, how much of that would be covered by Medi-Cal, and how much of it, to where there's no real cost to the county, and how much of it might have to be covered by county general fund or other funds? Probably not general fund.
So it's a kind of a complicated question, and I'll do my best. So whatever our salaries are, that's folded into our cost report, our cost reimbursement process. So whether the psychiatrist's salary is 100,000 or 150,000, just for ease of reference, those costs get folded into our reimbursement rate. However, not all of their time is spent doing direct service. So there's lots of their time that, we also have to account for. And so the difference in their salary impacts our budget in that way.
Okay.
Emmy, Connie, are you back with us?
I am. Can you hear me?
Very well. We just kicked a quick question to Emmy and that Tim Ash brought up, and that was about the challenges of increasing salaries and recruitment in terms of where the funding comes from. So you probably heard Emmy respond to that. So maybe I would just add that as a general question, because you cover, what did you say, 104 different programs about recruitment in terms of salaries, because a lot of us are very concerned about having enough staff to do things. And so if there was more money, or how would you get more money to hire more people?
Well, we have a ton of salary savings right now, and we have a number of grants and allocations that are not currently being spent because we're not able to hire staff. Huge issue for us right now.
Yeah. So you do have the money, you just don't able to recruit the people. Is that a fair summary of that?
It is.
Okay, that's it.
We have a number of vacancies. And
right.
Really across the board, it's not just in behavioral health, but other areas also.
I understand public health is short of a lot of staff people there. Is that correct?
Public health is short-staffed. Our eligibility staff are short. We had to close our call center one day a week so that people can actually do interviews during that time instead of taking calls. We're kind of in crisis around staffing right now.
Thank you for other comments or questions. I see Debbie and then Laura, but Debbie?
I wonder if you anticipate the expansion of Humboldt State to Cal Poly. Will that perhaps be something to provide more trained people locally here who are, more of a pool for you folks?
I'm part of the group of the CEOs of the hospitals, and we've been working on just building the capacity and career levels for all clinical staff, not just clinicians and case managers, but also nursing. So I'm very hopeful that Cal Poly is going to make a difference for us in building our capacity.
So am I. So
yeah, yes.
I'm curious about, how that all is going. Maybe over time we'll hear more about it at the Behavioral Health Board. it seems to have potential.
Thank
For
you.
sure.
I see your hand, Allison. I didn't know, Laura, whether you had a question first in there.
Thanks, Tim. I heard that SV was shut down on Thursday. Is that true? And if it was, how often does that happen? Because of staffing?
I don't think it was SB. It's probably CSU. And so Emmy, if you could speak to that a little bit.
Yeah, SV was not shut down. What happens is we have a max number of our census can only go to a certain number. And there are times when our staffing is so low that we have to pull from the crisis stabilization unit to maintain our ratios. And so CSU would not be accepting anyone, but SV wouldn't have been shut down.
That's tough.
Does that happen very often though? I mean,
It's happened, well, it just depends. It's happened more frequently recently because of our staffing crisis. So, and we're in, very regular and direct communication with the hospitals and law enforcement when we have to do that. But it is a problem because if we don't have enough staff on SV, then we have to have the staff from CSU fill in.
I heard you say thank you, Laura. Wanted to move on. Allison, you have a question, comment?
I have a couple of things. The first thing is, yes, public health was really fun in the past. Great food, great potlucks, fresh bread, like all sorts of things. Plus 7-minute workouts at every break. We all got together and would do that. It was wonderful. The other thing is, I'm just curious. I have one thought on teleworking, because that's what I'm doing right now. And my entire agency went to telework, and I know that's not entirely possible for DHHS, but I thought maybe sections of it might be like the call center, where they realized there was huge cost savings to it. Now they have a hoteling style set up in the office. So when we want to come in, we can come in, we reserve a space, come in, and it's set up like a hotel. You just plug in your laptop and you can meet with people. We have to reserve so many spaces so that everyone has a spot for it. But they call that the hoteling style. And someone did a cost analysis and realized that just even a cubicle space was costing roughly $11,000 a year per space. So they're giving us telework. They're still negotiating the contract right now, but we're gonna get like a payout every month, like $75 or something like that, 50 to 75, just to work from home and then still have that ability to go in. But I just don't know if that would ever be possible for parts of DHHS. And then I'm just curious, I know when I was there, we worked on that contract to bring in the psychiatrist, like the locum psychiatrist. And I'm just curious if there's any thought of really trying to have a full-time psychiatrist who lives here on board as the medical director. Because I always hoped that would happen. I thought it was like a temporary fix. And now it's kind of seems like it's a permanent thing. So I'm just curious.
I can respond to the second part and then maybe Connie can talk about telework more broadly. Absolutely, yes. My intent, my goal, my hope is to have a medical director employed directly by the county that lives locally. That is my dream. And that's the work that's happening. We actually have going to the Board of Supervisors a job spec for the medical director so that we can move forward with a recruitment, given the increase in salary that I hope will be more productive. So
thank you.
And then for the telework policy, the county the Board of Supervisors just approved a new policy for county employees. It is based on department head discretion. And thankfully so, because we have areas that we couldn't allow telework because of the job that people do, and then other areas where it really does work. And also some people telework really well and other people don't. So I feel like we have a good opportunity here. I know that in some areas we have up to like 30% of our staff that are still teleworking a majority of the time. And then come in for meetings or supervision and that kind of stuff. I think that Zoom and teleworking is a really wonderful option for a lot of people. And it seems to be working well for a lot of folks. The part that I miss the most about everyone being in offices is just being together and having the relationships that we have with our staff and our teams when we're all together in one area. You know, Zoom is great and you can do check-ins through Zoom and that kind of stuff, but it's not the same as being in person. And so how we make that happen in the future, those are things that we're working on now. That's one of the reasons why we're having communication around the conference room, because we want to be able to have these meetings back in person, and then other meetings to where people feel safe, right? Because that's the other thing too, is we want people to feel safe in areas. So we need an area big enough to spread out. So yeah, I think telework's here to stay for the county.
And I'll just add to this conversation that it really depends on what is happening as to the appropriateness of telework or telehealth, for instance, because there are certainly services that we want to have face-to-face with clients, between clients and providers. And so, and they don't all have to be that way. Like there's a lot to weigh in determining, is it better to have access easier because telework allows for that? Or is this a situation where we really need to be in the room with somebody to really get the experience of what's happening for them and them to connect with the provider in important ways too?
Exactly.
Thank you both.
Okay, Allison, I see Tim's hand up. I'm sorry, you were done, Allison? Oh, okay, I want to make sure if you have any follow-ups. Yeah, Tim.
Yeah, I was just wondering if, as you kind of move more towards telework, if you are developing policies to guide the supervisors, and in terms of that discretion. The reason I say that is I've had a lot of years in government, and you know, the supervisors are kind of uneven, and some of them have different opinions on teleworking, and some of them, I think, there's some issues with morale if you have people who are teleworking and other people that can't, when there's no real difference. And my personal experience was I had the ability to telework, but I only chose it when I had certain kind of work that I didn't want anybody bugging me doing budget stuff. I just wanted to focus and writing and stuff. But the rest of the time, I, like you were saying, Connie, I kind of like being in the office and be able to walk over to somebody's cubicle and talk to them in person. But I did see, it wasn't so much telework at that time, but it was like alternative work hours that some folks didn't have the option. And, you know, they had, you know, people had families and they could have used a little flexibility, and there was no reason not to. And yet that particular supervisor didn't feel comfortable. And there weren't any real, you know, operational reasons to not allow it on, you know, with some constraints. So the big question is any policies to help from a morale standpoint to have it be evenly applied across the department?
That's one of the reasons, you know, before the policy went to the Board of Supervisors, they did meet and confer with the union, and actually the instruction is really for us to be as fair and flexible as possible with folks. And so, yeah, and you know, we want to retain our employees. And with telework being an ability for a lot of folks now, and actually people are living here and working for, you know, places in Sacramento and stuff. So we have to do whatever it is that we can to support our workforce and keep them happy. At the same time, we have a whole lot of community members that are struggling because of COVID and things that have happened over the last couple of years. You know, we know that we have more people suffering from mental health illness and more people suffering from substance use. And so how it is that we ensure that we are, supporting our community as best as possible is important too. And so we have to manage both of those. But yes, we're absolutely working on policy. We were building policy and procedure, a year and a half ago or so. We sent everybody home quickly in telework because of COVID, and then started working on what's it look like? What all do we have to have in place? How are we supporting? What are we making sure that everyone gets supervision? How often are they doing that? When are they doing check-ins? There's so much involved. And it's so different. And it depends on where you work in the county, whether it works or not.
Thank you, Connie. Other questions? I have one that just came to me. One of our roles as a board is ultimately to send advice, not just to the department, but also to the Board of Supervisors. And so I think we're gearing up to do more of that. I'm wondering about how you can help us in our capacity connect to the Board of Supervisors, and either Connie or Emmy can respond to that, because I think it's kind of a weak thing, partly because we weren't able to do that. It's really hard for us to develop something that we want to send directly to the Board of Supervisors, but it is an important part for us to do. So what are your thoughts on helping us to do that work?
It depends on whether you want to do presentation or whether you just want to submit a letter to the Board of Supervisors. Because or if you're requesting to get on an agenda, we can absolutely assist with that. I know that Tim, is the annual report the only thing that you've in the past gone to the board with, Tim?
No, but there's a few other things, and we've gone over there. Well, for May's Mental Health Month, you asked me to go there one time for Laura's Law, but yeah, we haven't done a lot of it.
Yeah. So what I would say is, when there's interest, let us know and we can help you get there.
Thank you. Thank you.
That, Tim, I just want to add to that. A couple years ago, we had a woman who came over from Reading, who was hooked up with some statewide organizations, had a lot of experience with mental health boards. And she helped us with our meeting similar to this. And one of her suggestions was that we just do just what Tim's talking about, is keep in mind, opportunities to get to the board to kind of increase the visibility of mental health issues and things that are happening in the community, and to also make sure the board knows we're here. So I think that's but that her suggestion was going to the board would be a helpful thing to do a little more often than once a year.
And what I hear saying is that we don't always have to have a particular approved recommendation, but we can also go with a general presentation as long as it represents the whole board. Is that what you're saying, Connie, and your understanding, Tim?
I believe that you could pick and choose topics to present to the Board of Supervisors if that's what you wanted to do. I would say, though, with any presentation to the board, they request that it only be a certain amount of time, right? So
Yeah.
So be thoughtful about that, about planning around that. And if presentations go too long, we just watch our Board of Supervisors' eyes glaze over. They quit listening. So
yeah,
I apologize for saying it that way. They're my bosses.
That's
No, it's
the
true.
advice we need.
It's true. And Tim, I guess what I would say is, I think the best way to do that would be to kind of coordinate with Connie and Steve on that. Just as if there's something that we wanted to, just say, this is kind of a new thing that's going on, or a new issue that we want to make you aware of, but I would coordinate with those two to decide if it was really appropriate.
Thank you. I don't know, Debbie, whether you were waving at a bug in front of your screen or you wanted to say something.
Oh, just this, I used to go to the supervisors with,
Debbie, we're not seeing your face. I think you
I
hit.
don't know what happened. Oh, I'm still here. I'm still here, believe me. Oh, just really quickly, I can't find my face, but I used to go to the supervisors like once a year with our youth program from Planned Parenthood. We had a youth education program, and they were always so, I mean, it was like they woke up
Nice.
when we came with the kids, who were really articulate and wonderful. So I just, to add to, you know, being pointed when we do go to the supervisors is good.
Thank you, Debbie. I see a hand from Allison. You're muted?
Yep, I'm trying to get off mute, sorry.
Okay.
I just had one really brief request, and that was for the MHSA page to be more accessible, like to be able to find the newest information. I had such a hard time finding it, and I mentioned that to Kathy at the meeting yesterday, and she said that she even had a hard time finding it and had to have the analyst find it for her. So if the comms department could work on helping that page be easier to access. And I feel like I'm I'm pretty well versed in that page typically, and I still struggled with it. So that would be great. Thank you.
Thank you, Allison. We can go on to any last minute things. It's getting close to 12:30. We'll honor our time with Connie and Emmy in our general agenda, but we do have some more time. Comments or questions? All right, thank you. Let's take a 33-minute, let's try to be back here at 1 o'clock, the rest of the board. And Joe, you're gonna just keep it open for us?
Yeah.
Okay, thank you. And thank you, Connie. Thank you, Emmy, very much.
Thank you, and
Thank you,
thank you
guys.
all for taking the time today. We really appreciate all of you. Thank you so much.
I hope your grandson's doing a little better.
He's sleeping.
Hopefully sleeping. That's what I was gonna say.
Yay!
Yeah. All right. Thanks, you guys.
All right,
Thank you.
everybody.
Thank you, Emmy.
We'll be back at 1 o'clock.
Okay, see you, Tim.
Okay, see you, Tim.
Can you sing the UCLA fight song for us?
Hail to the hills of Westwood, to the mighty sea below. Hail to our alma mater, she will conquer every foe. For we're loyal to the Southland, her honor will uphold. This is the part that's great. We'll We'll always give our heart to thee.
Nicely
blue-
done.
What?
Nicely done.
Thank
Did
you.
Laura know that too?
We could go around the room and everybody sing their college fight songs. That's what Tim asked. No, I say, then I say, no, don't go there. Don't go there.
Well, you're lucky because I don't know mine.
My mom and dad went there, so they kind of made me do it.
I didn't have a college fight song, but I could sing the Stanford and Cal drinking songs, which I was taught by friends back in high school.
Are they the same song?
California, California, we're out to do or die. You know the reason why. I could go on, but I won't. And we'll win the game. We know the reason why. And when the game is over, we will buy a keg of booze. And we'll drink to California till we waddle in our shoes. So anyway, that was a long time ago when people sang such songs.
That's right.
I don't know if they still do.
Well, welcome everybody. It looks like we're all back together. Thank you. Again, thank you very much for being here. I thought our time together before was really great, but I thought our time with Emmy and Connie was particularly helpful for us, working with them, connecting with them. There's always more things to ask or say, but I always appreciate their sharing with us. So let's move on. Tim Ash and I have kind of structured this next time, and I think kind of is a good way to describe it. I want to go through what's involved with a meeting, and in that process of talking about what we do in a meeting, maybe go some basic things, but also how a structured meeting helps us get things done. And then Tim Ash is going to focus more on the actual bylaws, responsibilities, things that are what our rules are, what our committees are, and things like that. And again, it's open for lots of discussion. So I just want to start about our meetings. Length of meeting is 90 minutes. It was 90 minutes, an hour and a half, and it's now 2 hours. It seems to me that was done about 3 years ago. Not sure I was on the board at that time. Does that sound right to you, Tim Ash, about 3 years ago?
Yeah, about that, maybe 3 or 4.
Okay.
Yeah, right in that range.
The idea basically is that we needed more time, and particularly more time to discuss issues. Things would be brought up and we just felt like we had to move forward. So that's open for us in discussing how we do meetings and how we make them more effective and working. This time that we choose, 12:15 to 2:15, we've kicked around different times, particularly people who might be working during those hours and not able to attend, but more able to attend in the late afternoon, early evening. But it didn't seem to make a big difference to change everybody. And honestly, part of it is that staff can participate. It's part of their work. But that's always open for us to discuss that. We've talked about different locations, particularly perhaps in southern Humboldt, to get more people to participate with us down there. That's when we did a lot more driving to meetings, but that didn't seem to make a big change in the amount of participation. So I just wanted to kick those things out and let you know about that part of our meeting. I just want to also say that when we come to that part about adjusting the agenda, I want to be clear, things can't be put on the agenda, but we adjust when it's going to be there, or maybe just to make a comment about who's going to be doing it. But pretty much it's to adjust the flow of the meeting. The setup of the agenda is kind of the way meetings are done. If you look at various best practices, I've been running meetings like this, or part of them, it seems, for 40 years. And so just the framework of the agenda is kind of standard, not that we can't adjust it, but it's built to make sure we cover what we need to cover and how we cover it. But again, I just wanted to say that that's how the agenda is structured. So I want to move on to public comment. Today's meeting is an open to the public meeting. Anytime we get more than a majority of our members at such a meeting, and Tim will go further into the Brown Act, then it is a public meeting, but nobody attends this. And so I kind of skipped over the asking the public to participate. But in public comment, basically, the rule is an opening period in which we ask public comment on the general areas of jurisdiction for the behavioral health department or the board. Although people can talk to us about anything, and sometimes they do, if they want to talk about homelessness, there's only a certain part of that that we cover. If they want to talk about public health, you know, they get a chance to make that comment. But we do ask them to focus on that what we call the jurisdiction of the behavioral health department. The time limit of 3 minutes is an important one. We often don't have a big problem with that because we don't have that many members of the public showing up to share. But I try to keep it there. I don't do it very strictly. But if it goes on too long, then I feel I need to do that. Basically, it's one comment. It's not a discussion time. It is to share a comment about it. We do not have to respond as a board or by staff to what people come. We receive comments. Sometimes it just seems the right thing to do and refer something for someone else a question about a particular program to staff. If they're asking us to do something then about it, then we take that into consideration and don't have to respond at that time during that public comment. The other requirement and best practice is to have time when we have items on the agenda for public comment. And I try to do that all the time, but I don't always. And so I just want you to keep me focused on that. But that is their time. That's why we publish the agenda. That's why we don't change the agenda. People can come and talk to those agenda items. It is a best practice to have more than just a statement there, but to describe what it is so people can actually know what to say. We don't always get that done. For instance, on the agenda was the video recording of our meetings. If somebody in the public were to see that, they wouldn't know necessarily what we're talking about. And so to put another sentence in front of that helps with the public involvement with agenda items before the meeting actually begins. Again, it's pretty much not a public discussion, it's a public comment period. And it seems best practice is just briefly say what we're doing and then invite public comment about that. It's not typical to have public interacting and involved with that issue. Sometimes if there aren't too many people there, I will allow one. I don't want to do that a lot because I don't want it to become kind of an open discussion going on. But sometimes I'm kind of lax on that, and I want the public to be a part. Another thing that happens during public comments or discussions is that the staff will raise their hand. When we were discussing video recording, Laurel raised her hand and shared an important thing to share personal. But it's really time that they're not public and they're not on the board. Again, I'm a little lax on that, but and it's hard to say that. I would just go to Emmy, say, Emmy, you need to control the staff because we want to make sure it's a board meeting. We're a deliberative body. So when the public is involved, we want to keep that focus. Sometimes in general, we don't spend enough time deliberating. And I want to go to that a little bit more. So that's the general sense of inviting the public to become a part and make their comments. So going down the agenda, there's a section called communications. And that basically is the time for, yes,
I
question.
just have a
Nelson.
quick question. So when I just wanted to point out, like sometimes staff, I saw Debbie Hart do this. She attended as the public. So I think she said she took time off work. She
Yes.
told me this one other time, she takes time off work to go to the board meeting and then be represented as public. So I think like sometimes that's happening too. Right?
It
And then
is.
it gets a little confusing maybe. Or...
And Debbie has kind of a dual role in terms of the Family Advisory Board. She volunteers to take those minutes and ends up becoming the only spokesperson for what's on their agenda. But I'm aware of that. And in other words, she's speaking not so much as a staff member, but as a representative of the Family Advisory Board. But I agree with you. We just don't, they're not members of the public, but I think she comes as that. Does that make any sense, Allison?
I think so. Yeah, she stated she was a member as a member of the public. That's how she was at the meeting. So
I know.
I was like, oh, okay, interesting.
Yeah, we could ask her to clarify that. I saw a hand from Laura and then from Tim Ash about this. Laura, do you have a question? Are you ready to? Yeah.
So I had a question about like the agenda, and it seemed like when I first started, and I haven't been to that many meetings, the action items were up at the top so that if somebody has to leave early, we always have a quorum. And I noticed they've been moving down. I'm not sure why that's happened.
Well, it's pretty much always been that way. For instance, we'll have a presentation before the action items. We often haven't had that problem with not having a quorum. And so it is important because many people have other jobs on the board and to have a quorum. And it was kind of frustrating to have that conversation about reporting and then ready to, to act on it and then not having a quorum. So I guess that's open for discussion, Laura, about where to place action items on the board.
I have been on a bunch of boards, and it seems like those were always like, let's take care of the action items at the top of the hour kind of thing. And I'm sure I haven't been on as many boards as you, but I always feel like that's our business. And then we can get into the discussion so that's just one thing. And then, shoot, the other comment was, in reading the Brown Act open meeting rules, it says public comment before or during agenda items. And I was just curious if we have a presentation, if there can be public comments immediately after it, because it brings up so many questions. And then, or just things people, not that you have to answer it, but we're educating about something, that seems like a good time to have public comment, unless for some reason there's a reason why you don't do that.
It depends on how we describe it in the agenda. And we can do that, and we have done that. What the agenda item properly should say is presentation on this, questions and discussion on the topic. And if we do that, then it's fine. And we've done that in the past when we didn't have that good of agenda descriptions, but that's what happened. We always, left time for questions and discussion.
Okay.
Hey, Tim, so I wanted to go back to the issue of with Debbie and public. From our standpoint, it does matter. It's good for somebody to identify if they're speaking for the department or they're speaking for themselves. That's really the issue, that is the issue. But we haven't always been rigid in terms of that. People, sometimes staff, sometimes public, that want to get into it as a discussion. But really what we should be doing is having our describing what the item's about, just sort of like a staff report, or if a board member has brought something to the board saying, I'd like to talk about the time of meetings, and I've heard from this person and that person and think we maybe should meet at midnight or something. And then what is supposed to happen is we hear from the public as far as what they have to say. The staff could speak then, but typically they don't. Then I think Tim was saying this the other day, then after the public has had some input on it, then there's time for a motion, and then it goes to the board discussion. And the big thing there is to make sure that everybody there knows that that's the time when we as a deliberative board are supposed to be, discussing the issue that's on the table. And I think this is what you're saying, Tim, is that even though once in a while somebody will just speak up, and it's kind of, so, it happens so fast, you just kind of go with it instead of shutting them down. But really that time is for us to discuss the motion on the table and then eventually vote on it. But it's not meant to be a roundtable. And that was the issue that came up with TAY. The folks from TAY didn't like that. They thought they should be at the table, literally, and should be able to speak whenever they wanted to during the board deliberations. And, while the, part of me goes, well, yeah, great, everybody at the table. But as far as for Tim, anybody that's sharing it to manage the meeting and the timing, and it doesn't work well.
Yeah, that was part of our discussion, is they didn't understand we were a board and a deliberative process, and the board needs to be the focus of it, not an open kind of thing. So I guess this brings up an issue of the difference between an action item, a presentation, and an issue brought forward for discussion. And there's not always a tight, except for an action item. I was saying the communications time is perhaps the best time for board members to bring up issues and invite a discussion. You can use that time just to say, I read this article about so forth, and I think it's a good one, and it'd be nice to talk about it. Something as simple as that. It keeps those things before the board and before the staff as well. But if there's, what?
Go ahead, I interrupted.
I say, and then the other time that can be used that is, I think it'd be important that we have a discussion about this. And you're calling for the board to say we need to set aside time to address that issue. And it seems to me that that's a good time to, if not so much on the agenda, but to put that on the agenda for the next meeting. All right, let's carve out some time for the board to have a discussion about whatever that would be. Then the second thing is an action item and on the agenda, and we can't create one on the spot because of the public involvement. Yeah, because I just believe that's best practices anyway. But it seems to me that process is for committee or someone to say, come to me, we set the agenda at the executive board meetings. I want this on the agenda, and I would like to bring this recommendation, proposal, or something like that, where you want the board to speak as a group and vote on what we're doing in that area. So that we do that, we put that agenda item on as an action item. And then it seems to me the process should be a general presentation. I rushed ahead with the whole idea of voting on the video recording of things. And a part of that I thought is, well, we were ready to vote on it. Do we really need to spend a lot of time discussing it? Has it been discussed? And I thought I was just picking up something that we had talked about before. And I was just kind of going on my general instincts on that, sloppy as they are sometimes. But if we have a motion, we didn't have a motion. And I think it's important at a certain time that we know what we're approving, what we're voting on as clearly as we can state it. So we then have a more specific, know what we're talking about. And so, but that action item, it's good to be the person bringing the motion and say, this is the general issue why I'm bringing this motion and I want us to act on. And then somewhere there say, well, this is specifically what I want. My motion is to do blah, 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 blah. Then we have this procedure that very seldom gets complicated on our board, but the request for amending it. So there is a process that you can have a substitute motion, for instance, but I don't like that motion at all. I think we should do this and make a motion on that. Or the motion is fine, but I think it should be amended to include this or that. That was involved in that the motion that we had in terms of recording that. And I felt that went fairly well because I just don't want ongoing discussions without a certain point that we're going to make a decision on that. We do a lot of talking, but I want some kind of pushing into that area to do that. So the general information about something who's bringing it forward, then a specific motion. And when that we have a motion on the floor, then we can actually discuss it, debate it, deliberate about it. We can't deliberate anything without a motion. And we can adjust it. We can do different things with it as we move forward. There are things that we can do if somebody hears a motion. I would like to refer this to the ad hoc committee, to something like that before we vote on it after a particular motion, which it might be very helpful. You say, I want to hear more information. We would vote on that because we have a motion before us. Or I'd like to table that. I'm not prepared. And I'd like to table something is basically to put it on the table and deal with it later. Sometimes that's an approach just to kill something. You can table it forever. We never get a chance to do that if somebody doesn't have that energy. But I would like to see that as a possible way of people saying, I'm not ready. Can we vote it on at the next meeting? Let me move along.
Hey, Tim, before you do that,
Yeah.
I wanted to circle back on the communications thing. I think I disagree with you a little bit on when we're doing board communications. Really, it's not a Brown Act. It would be a violation of the Brown Act to have a discussion on the communication. Really, it's meant for somebody to come in and say, I want to tell you there's going to be this, or I went to a meeting and this happened. You could entertain a question if somebody said, well, did this happen or did they talk about that? You could do that, but the discussion should be, as you said, if it looks all of a sudden they're trying to have a discussion, you go, well, this sounds like there's a lot of interest here. I think maybe we should end this here and then have it on one of our next couple agendas as a discussion if it's the pleasure of the board to talk about that. So
yeah, that's a good point, and that's kind of where I was going with that. But you're right, to understand clearly, it's to share information.
So the second thing I wanted to mention was this is kind of a sales pitch to some extent, but that one of the things that's open to us that we haven't done, except for with MHSA, is to have workshops. And that's an opportunity that meets the desires of folks like ATE that want to get involved in a discussion, because there's a difference between just getting your 3 minutes and you're done, and a interaction, exchange of ideas. And that's something I felt that would be helpful on certain issues, that would be helpful to the DHHS and to the community. And I want to do this for a long time, is to be able to go up to HOOPA and just talk about remote rural services and allow the community to freely, engage. We would hear from them, the department would hear from them. And it's not inhibited by the Brown Act as much.
That's a good point. Laura, I see a hand going up.
So what I got from Cal BHB is that you can have listening sessions, and they actually have a format for how to do a listening session. So something like what what you were saying, Tim, it's like, we're gonna have a listening session in Hoopa or, and that's where you get feedback from the community. Is that what you were talking about, Tim Ash?
Yeah, yeah. I mean, it's a hearing. I mean, that's, they're also called hearings, but not to be formal, just really a round table. You wouldn't have to be up in front. You could just sit around and say, hey, we want to know what you think about services.
And we don't put a strict time limit on it or things like that. It's meant to be an open forum kind of a thing. So I wanted to move on to something else on their agenda. We call them presentations. And there's always kind of a mixed feeling about, Tim Ash and I have kind of gone back and forth on this. A presentation is simply, I often call it a dog and pony show. Okay, so Paul Bernanke did something on sempervirus, and he has this PowerPoint presentation on it. And so he gives us information. He just lays it out, and then there's times for questions, but it's often just a time for general questions. It is not enough just to have a presentation. In fact, that's one of my most frustrating things over the years was the board, as we have someone do a presentation. I remember Juvenile Hall, we had a presentation, but do we really know what's going on there? Can we do our role of evaluating it, reviewing, evaluating, and then advising on that? And we just can't. If we don't have presentations, particularly new board members, they don't know what it is. They can't even begin to start the process of evaluating and advising and deliberating on it. So if we just fill our agendas with presentations, we won't do our work. If we don't have presentations, then there's a whole bunch of stuff we don't know anything about. We can't even go. So that's my theory on that. I often ask you board members, do you want a presentation? And I, in the executive committee, am looking to say, all right, what's happening here? What's happening there? In the executive committee, we're just looking, well, who can do it? When can they do it? And we're deciding that process. But bring to us requests for a presentation. A presentation, someone comes and we often say, well, how about 20 minutes with the discussion, question, answer after that. And so when we're putting the agenda together, we're thinking, well, how much time? Well, let's see if we have that total. We try to keep it into 30 minutes so we can get everything done. So it's slightly different than a discussion, but both Tim and I agree that after we have a presentation, we should have another time to evaluate it and discuss it. Even if we don't have an ad hoc committee pick it up and then do that evaluating process, is we could just have an open discussion and ask everybody, let's talk about it. Your question, how do we, what do you want to know about this? So for instance, sempervirens one, we could just an agenda item, and hopefully it would be the next meeting. Let's set aside 20 minutes for the board to discuss these issues. And it's appropriate for Paul Bernanke, for instance, to be there, but it's our discussion. So that's an idea. One of the reasons why we've expanded to 2 hours, and but a process for the agenda so that we can go a step deeper, into that.
Tim, I just want to say the expansion to 2 hours was part of, it's just kind of what you just said, is that before, when we had the presentation, after we had taken care of other things that we needed to do, there was really no time for discussion. And for a while, we were having the discussion in the following month, and that didn't work because everybody would just come in with this blank look on their face, like a month worth of life had come by, and they're going, whoa, what was that? And all the questions that they generate during the presentation are gone. Yeah. And going to 2 hours allowed us to do both, as long as we didn't have a lot on the agenda otherwise, with things that we had to do.
No, that's true. It's moving it from a question answer after the presentation to a more open discussion among the board about issues moved on. But I agree with you, but I don't think it's wrong send some times to table it for the next meeting because we want to all think about it ahead of time. So whatever works
Yeah.
best for
It
me.
didn't work well, that's all I'm saying. And not that it couldn't work well, but it didn't.
Yeah, no, I want to work with what works. I see a hand from Allison and then one from Laura about, we're talking about presentations in general.
Yeah, I'm just hoping that in the future, the presentations have more data in them, because so far they haven't really included data. And I feel like every time there is one, and I've missed the last one, but prior to that, there was no, like about the jail services, there was no data just readily available and everything. It seemed like most of the questions were around data, and then they'd have to go back and check with someone else. So I just feel like, could we preemptively ask them to include data in their presentations? Because I feel like it's so important and we're not getting that at all from what I've seen.
No, I agree with that. And that's kind of when we set up a presentation at the executive meeting. I have pressed them on that. For instance, with Paul, what is the wait time? How many this, how many that, you know? What can you tell it, as opposed to we do this and then we do that? And I agree with you. And what I hear you saying is that we just need to press them ahead of time. It's the kind of work they don't always want to do, or are not prepared to do that because they think presentation is dog and pony. And so I agree with you. Want to keep pushing that, you know.
Maybe we could just have a standard list of like number of clients served, unduplicated clients, you know, whatever category it's going into.
Yes, no, that would be good. And you could help, other hands are going up, but you could help us with that. Because I remember discussion about the Hope Center. And I want to know how many different people, where they come from, what are the results? How do you measure them? I was on the Continuous Quality Improvement Committee when we discussed the warm handoff from Semper Virens over to the Hope Center. It was almost impossible to make that work. But those are the kind of questions we want answered. I kind of want to go to Laura and then Debbie. I don't know if you wanted to comment, and Tim Ash again. So Laura?
So I'm wondering if we can set up the process so that we're going to do a presentation, and at the beginning, if you have questions about this, please type them in the chat or email lauramontagna@gmail. And these questions, after this presentation, we will follow up with them, and our next meeting, we will have the answers to these, and then we follow up, like an accountability kind of thing. Because if we set that in motion, then when we get the reports, people know they're going to have to answer them. So it might behoove them after we're all to like get the information up front. And then for me, what that would do is I can invite people don't want to come and sit in these meetings necessarily or feel overwhelmed. So if you say, we're going to be addressing this, we're having a presentation, and at that point you can give your public input, and then we can get the answers to these questions, then we have something in place that's letting people be heard, and then we can follow up. That's an idea I had.
No, I think that's a good one. It allows us to go a step deeper into the discussion. But what I also hear you saying is let's gather that information as best we can, and we respond to that and put it on the agenda item then like the next meeting. Do I hear you right on that?
Yes, absolutely.
Okay, thank you. There's a way, Debbie, and I see Tim Ash.
No, you know what? You guys are covering it very well. Thank you.
Okay, thank you. Tim.
Yeah, I think what I would suggest is dovetails well with what Laura just said. But when I've dealt with presentations in the past, a lot of times there's a fair amount of discussion ahead of time with the person, and they're always going, well, how much time do I have? What do you want me to cover? And that. So, you know, and also in the past, we actually set up a schedule for presentations during the year so that we were managing how many we did and what they were, make sure they were ones that board members wanted to hear. And if we were to do that, we could, a month or so before, because we always try to give the people at least a month or two to put it together. If we, a month or two, spent 5 minutes, generating scope of the presentation and any data that we would like to know about. We did that 2 months ahead of time with a short discussion somehow, whether it's an ad hoc or the full board. We could provide that to them, and then they would come with the data that we're interested in, because they probably have reams. A lot of these programs have reams of data, but to actually focus on the things that we want to know about. I don't know if that would meet people's concerns about having data.
Yes. Yes, I guess at a certain point, we're actually getting into a report that we evaluate and discuss and deliberate. And I kind of want to keep us loose on that, but a presentation is primarily meant is to give us information. And we're pushing to give more accurate or complete information and to discuss that. And so we have tried in the past to do a regular kind of a 10-month layout of the agenda for presentations, and we don't always get that done. I haven't done that. You and I know we've discussed this and been advised maybe we could go through the annual report and then take segments out of it and make a presentation on them. And then we can all know ahead of time in 3 months we're going to deal with such an item. Those things are important. Sometimes they're simply beyond our capability to do them. But those, I really appreciate this discussion and making presentations more informative and accurate and not a dog and pony show. So the more time we can select what the presentation would be, find out who's going to do that, give them a list of things that we want that presentation to include, and then opportunities, perhaps as much ahead of time or afterwards, for questions that other people might have, and we can to deal with, including that input. That's kind of where I'm getting from all of this, our discussion on presentations. So thank you. Thank you. So I just want to cover reports, and that is, we have standard reports from staff, for instance, Emmy and Connie, and sometimes they're thinking on their feet. Oh, what about this or what about that? And sometimes then I will push, Connie, can you come and talk about this? And then they'll go, oh yeah, sure, I can do that, and so one of the things I would want is, it'd be nice if they had written reports, more detailed reports, as opposed to kind of thinking on the fly with their reports. Let me say this is a part of my role as a chair, I think, is in that discussion to prompt. Well, ask, Emmy, can you share about this? Or can you share about that? If I feel like they're not bringing things enough to their report. But those are standard items. And I have added things, and I want to just invite you to talk about that. And for instance, when AOT came along, I was so afraid it would just get lost. So I put on the agenda, this would be a regular item, AOT. This is going to be a report. And so if you've been the last couple of meetings, Jack Rizell, who's kind of managing the establishment of it, to make a report. To go further, have an ad hoc committee dig more into it, I think is really important. I think the AOT program, the first time we get almost $1 million to deal with such a big and important issue, we just can't let go. So putting it on a report, do this every time on those reports. I'm thinking of 3 other things. In fact, Tim and I were just talking about it the other night, and that is, again, to help the process, I want to put on the agenda committees. And just to put it on there so that every ad hoc committee or task force knows you're regularly on there. And if you're, Allison, your committee working on the MSHA, you're there, and you can speak to that. You can tell us a little about who you are and what you're doing, even if you don't have much more to report, but that you have a place on the agenda. Okay. And I would be nice if people would let me know ahead of time, but if you're an ad hoc committee dealing with criminal justice system, then know that's your time. But as committees, subcommittees, provide us enough clarity, what your focus is, who's on it, and how you're doing. But that, and I don't want to be too rigid about it, but I want to make sure on the agenda there is a time placed there for committees. Mr. Ash, Tim.
Yeah, I just wanted to mention just a little history. We used to have reports, I guess it's a caution. We used to have reports, regular reports of all our committees. And what seemed like happened sometimes is people were prepared to make the report, so they came in, and I think they felt like, even if they hadn't been doing much, they felt like, well, I have to report. And so they'd spend a bunch of time talking about, I mean, I'm being facetious, what they hadn't done, but just that not much had happened, but they took a couple minutes to tell you that. And so I know Virginia Bass got frustrated with that. I wasn't paying attention, I guess, I didn't care. But she said, we're taking a big chunk of limited time, and that's when we had an hour and a half to go through this. Maybe it would be more efficient to ask those committees to just submit a paragraph or two of what they're doing in writing, and we can review it on our own time. And then if somebody has something specific, like they just accomplished got the recommendation ready or something like that, they could request the chair for some time to actually report on that. And that's actually what we're currently working under, with the exception of AOD and dual recovery, which there was a push for having them be regular to make sure that they were not lost in the shuffle, because it's both a mental health and an AOD, and an AOD board. And for those that don't know this, there used to be two separate boards in the county. One of them was AOD, and then there was a mental health. AOD was kind of dying on the vine. They didn't have members, and they said, why don't we put it all together and call it behavioral health? But the bulk of the people on the board were really focused more on mental health issues. So they said, let's just make sure they don't lose it by having them be a regular reporter.
Yeah.
But anyway, I would just be, in terms of time management, be cautious about having regular reporting by all the committees and all the ad hocs, which, it could take a lot of time.
That's a very good point. And so I guess that's the thing. You do not have to report. You can simply say nothing to report, and to be focused on those issues. Spend the amount of time that you think is important. But go ahead.
If you leave it like that, there's a risk that people are going to feel like, well, we have a committee, we should say something. Whereas if the protocol is, you report if you have something to report, but you talk to the chairman ahead of time to let them know that you've got something to talk about.
So one of my whole ideas is just to make it available. And so every ad hoc or subcommittee doesn't need to report. If you want to know when you get a chance to report, I wanted that. And maybe that's what I need to clarify.
Yeah,
you don't have to make a report, but you are on the agenda. And let me know if you got something that helps. Thank you, Allison. Tim and I have been talking about difference between policies and procedures and bylaws, and you might be very valuable in helping us. If the bylaws get too deep, then they're really going into policies. and procedures are just, in my understanding, we've decided this is the way we're going to do something. For instance, we could put all of this in the bylaws, but then it might be moot later on. Whether it's moot or not is open for discussion. So yes, speak.
Well, I just did this for the CASA board, and we have our little committees section, and then it has guidance for like how the committees behave and when they report out and things like that. That might be helpful in the bylaws, just a thought.
Yeah, okay, guidelines or policies. That's the kind of thing. What we voted on recording was not a procedure. It wasn't in addition to the bylaws. It was a policy.
Okay.
And to me, it kind of fit. I mean, maybe wrong on that, but I want to try to provide some clarity on that by making it a policy. And Tim and I have talked about that. Well, then we need to have them clearly stated, and not because sometimes Tim and I would say, we used to do this, it's not a policy on that. So we're trying to refine and to work on those things again to help us work better. Laura, I saw your hand up.
So I'm always talking about Cal BHB, and I love going there because everything's nicely organized. You can search it. And so they have the Mental Behavioral Health Board and Commission task list. And I emailed it to you, Tim Doty, and I don't know if anybody else has seen it. But what I really like is that it kind of tells us what we should be doing. And like it says, executive committee, you review ad hoc and site visit reports. And so like just saying, if we were to do this or kind of follow this or like modify to this, then those reports would come and then the executive committee would say, well, it looks like you're ready to give us a report, and then put that on the agenda.
That's good. I don't remember. Yeah, no, I don't remember receiving it. 90% of that could be my fault. But if you could send it to me again.
I just sent it right now.
Oh.
And I'm happy to send it to Joe.
Well, that's very, very helpful. And it's an important, I'd say an important guideline, and probably as a group should be a policy statement that we would include that. And so Tim, Ash, and I are just thinking about, we don't, what is our standard procedure for dealing with this, and what is our policy, for dealing this. And so that's, that's where I'm going with those things. The ongoing, I just so appreciative. I am not a wonk on those kinds of details. And I'm so glad that you when you say, Laura, I love data, I'm going, well, what kind of person is that? I know your creative
An
side.
awesome, crazy person. Yeah, just like
right.
us. Woo.
Okay, cool.
I like that.
So I wanted to talk about two other things I'm sorry, did I miss somebody? I'm just chatting away. Okay, two other things I want on the agenda, which has been standard for my past experiences. One of them you call old business or unfinished business. So that we often say, well, let's deal with this later, or can we talk about this sometime? And oftentimes my experience is we end up having 4 items in old business, and then we say, well, let's do it later, and that old business item can disappear after 9 months, but it's there, it reminds us. And so in the agenda, some of this would, Joe, would be, be directed by the chair, and I would just say, or ask the person, can we put this on old business? And then it becomes an agenda item by that statement on it. So I think that's helpful. We may not use it that much. I just don't want things to get lost, that we feel like we don't have time and we want to get back to it. So that becomes old business. I don't know how to call this. We used to have something called new business. And my experience is that people would bring things. Here's something new I thought we'd talk about. And that's not what I'm thinking about. Is a new business place for that is that a more time on the agenda to say, when can we do this? I'd like to see this, looking forward to the future about things. Sometimes that'll come in presentations or discussions or sharing of information. Again, if we do that kind of a thing, I would like us to put it on the agenda, not just what's a carryover, but what we've desired to do in upcoming meetings. And I'm open to anything way to name that as opposed to new business. But does that make sense, as to have an agenda item where we dump things we want to do for the future? What do you think, Allison?
I think I just Googled it because I wanted to see what the best term for it was. And it says old business means that you are reconsidering matters already disposed of. Unfinished business means that you are continuing with matters with which are currently not completed.
Unfinished, that's the right term, unfinished. Okay. So we have an executive committee happening on Wednesday, and this is when I want to go and write down these items, issues, particularly how the agenda is going to be. I guess I want to wrap up. We don't have.
Tim, before you do that, I just wanted to throw in there, for the one you were calling new business, I understand what you're saying now. I think the way we've dealt with that in the past is it does have to be agendized. You know, we just can't have new business as a placeholder and then talk about whatever. We have to be specific about what's included. And what we've done in the past, and is legal, is just to say a discussion item. So at any point, someone could get with you and say, I would like to bring this issue up for discussion at a future board meeting, and then you just pop it on the agenda. That's the way to do it legally, because then when you do that, it tells people it is. So if somebody's reviewing our agendas, they go, oh, they're talking about emergency room admissions now, I'll go to that meeting. But if you just have, if you have a sort of a generic, vague name, people don't know whether they want to show up for the meeting or not. It's not, under the Brown Act, you have to say what it's all about.
Right. I'm not sure that's an other agenda item, or whether that can be included in the description of unfinished business. Allison, what do you think? Do we need a thing on new business?
I think you do. And I think it could just be new business with bullets of what the new business is, like the topics, if it's ER admissions or whatever it is.
So does someone on the board say, I'd like to put this in new business, and we do that during the meeting?
No.
It would have to be on the agenda prior to the meeting. And then it could be, I think it could be suggested for a future meeting. You could have like future meeting suggestions or something on the agenda. And then people could share what they are and then put those on the agenda for future meetings.
That sounds good. So what would you call that?
Ideas for future meetings, just something really simple.
Okay.
Future meeting ideas.
I am ready to wrap up my time on basically the structure of the meeting and how we do things. I think this has been very helpful. We haven't had this kind of discussion in years. And so I guess I want to kick back to yours, Laura. I do am mindful we have other things to cover about where action items are. It has not always been my experience that we put them early on. But I think my experience has been is everybody's there. We're in the room and we're not gonna, walk out of the meeting, or somebody can say, I gotta leave the meeting, and then can we move it forward? But what I hear you saying is that if we have 3 or 4, even 3 or 4 different items, we should move on them before the communications. Is that what I hear you saying?
Yeah, and I think when it was a smaller board with 5 people, you pretty much knew you would have a quorum. And as we get larger, it may be more challenging. When somebody has, like Allison often has, she can be there the first part and not the second part, so that's why I think it would be good to get that stuff at the beginning.
Any other thoughts?
Just
Tim?
also, if it's a public meeting, then it's easier for the public to feel included if action is on the first part, I think.
Thank you.
Well,
Any
I
other-
can tell you, for what it's worth, one reason that we, as far as having that order, we've done that way before we were down to 5. And part of the reason, I believe, was to get, when people were coming to make presentations, to try to let them make the presentation and leave before we got into, discussion items and things like that. But I mean, theoretically, people on the board, if they're coming to me, they should really try to stay as long as they can. And I think it was just suggested that if somebody does have to leave and we have a critical item that we really want to get done this month, we've in the past moved it up to make sure we had a quorum. And that's worked. It didn't work too good for Allison the other day, but generally it does work. But there are some things we could move. There's a few things that could, our communications could go further back easily. I would rather let the public comment first.
Yeah, I think it's important we do the public comment first, but I didn't quite get your chat on that, Allison. I'm not always that good at reading chats and listening to people at the same time.
I was just saying that I should be at all of the future meetings. I was working on a certificate that I had to attend certain meetings to get the certificate. Now I have it and I'm done, and I should be able to always be there. But I also do like the idea of having agenda items at the beginning, because I've seen so many times, especially Board of Supervisors, where they have to leave early. They're only available for a little while. So if things are done right away, it's so easy to get them over with and then move on.
Okay, so one of the things I hear is Tim asked is that we can move communications, which is things coming from the board beyond, later in the agenda. I'm open to moving action items earlier. I kind of agree with Tim in terms of it was sense like do presentations first and then we can get into the meat of matters. So if it's a matter of having a quorum, then I would just as soon keep it the way it is, action items after presentations.
Okay,
You can ask though, you can ask people up front, can you all be here? Because we have 2 items that we absolutely need a quorum for, and we will move them up if you can't be here the whole time. That would cover it if we do it.
I feel comfortable with that. Laura?
Okay, I was also going to say, for the way my brain works is we have a voting job. Let's do it. Now I can settle into my brain wrapping itself around the presentation and all the information and what I want to know. So that's just me. And thanks for listening. And
you want us to accommodate your brain? Is that it?
I mean, we could always try it the other way and just see how
That's
it goes.
what I was thinking. My brain is like a bad neighborhood. You don't go there alone, kind of thing. So I heard that a long time ago. Another hand from you, Allison.
I think Debbie was actually next, or Deborah.
Oh, Debbie.
I was going to say one thing about having Zoom meetings is that people who are there to make a presentation can always tune out and be working on something else too, which is a plus for Zoom meetings.
They already do that. You notice them doing other things instead of paying attention. Allison.
I was going to just say, we could also schedule them a little bit later, like halfway through the meeting, half an hour in or whatever it is. So they're not sitting there the whole time and they come when they're supposed to present.
Yeah, let's do that. I think Tim is right. We can just give it a try and move action items earlier in the meeting. If it doesn't work, we can all blame Laura. But is that okay, Laura? Okay. Now let's just do that. And this is kind of a policy procedure thing, and I feel comfortable trying it out in 6 months. If it doesn't seem to be working, we can change that.
Hey, I have a question. Who's Galaxy S20 FE 5G? Is that Isabella?
I was wondering the same thing. Isabella, is that you on your Galaxy phone? I'm assuming it is too. And so let's move on to Tim, discussion of the bylaws. Yes,
It is her. Yeah.
All right, thank you. Thank you. So Tim, about half an hour. So why don't you talk about what you think is most important about from the bylaws or from the structure?
Okay, and I was looking around for my my binder. I couldn't find it. So if there's anything that I'm skipping that you guys know.
Speak up, Tim. Lean forward.
Sorry, is this better?
Yes.
Okay. Okay, in a nutshell, the bylaws lay out, and I'm not going to go into the details of it. You can read it, but I'll just kind of say what's in it. It lays out what our committees are, how we form committees. It lays out the various officers of the board and what their responsibilities are. It lays out information about our meetings, how they're to be noticed, what types of meetings they are, special meetings like emergency meetings or regular meetings, and the different requirements for those. And then it lays out our roles and responsibilities. And I don't have that in front of me. So what I'm going to do is I'll just give you the trimmed down version of the key responsibilities. There's other things that are kind of, they're in there, and it's actually in the legislation. But I'm just looking for my notes here. Basically, our role is to advise the Board of Supervisors and DHHS on the local mental health system. I will say that there's always been some lively discussion on how broad those responsibilities go, whether we're looking at the county system of care or the overall community system of care, if you want to call that. And I know my feeling is that we should be looking at the whole, because that's what provides the services to all of the people in the county, not just people that are clients of the county. But we're supposed to be looking at that system, looking at gaps, looking at opportunities for things that we could be doing, and we're supposed to be looking at evaluating those services well. So we have this service, how well is it working?
Tim, keep getting closer so we can hear you better.
Okay, I feel like I'm sticking my head in my screen here, but anyway, my nose will be all moving. Then we're supposed to be looking at, there's some really, I don't know, smaller ones that dealing with the data notebook and some reports that we're supposed to either do or review. Some of them we review them. We don't provide any comments. We are supposed to prepare an annual report. I really appreciate Allison's comments to take the triennial report and turn it into an annual report. I'm really glad that you're fired up about that. Anyway, we're supposed to review the facilities, county facilities, and there's been some lively discussion on that as well. For example, the jail. And people didn't say that's not a mental health facility, but the reality is it is. And we have people that are clients of the county and people that are have private insurance or whatever that are in that jail. And so anyway, that's a facility. Any of the facilities, well, any facility in the county, in my view, some of them we can't get access to because they are private and they have no obligation, but others are getting money from the county and other public sources. And, in my view, they're fair game, and what, if you look at what other counties are doing, they don't look at every facility every year. They have them on a rotation where They pick the ones that are most important and they do those, and some of them they don't ever do, but some of them, they might hit one every third year or something, like the jail might get one every year. Our board hasn't done too much of that in the past. We've done it a little bit, tried to, but just didn't have the horsepower. And I'm really hopeful that we're able to start doing that. And what I guess the suggestion that I'll just throw out here, well, I'll back up. Another kind of a big one that we haven't done is reviewing contracts. And the DHHS, or at least mental health, has a ton of contracts that they manage. A lot of them are pretty small potatoes. So my recommendation on doing that would be to get somebody, like we have people that are volunteering to chair ad hocs and to chair committees. We could maybe get a couple people to chair review of facilities and review of contracts. And they wouldn't necessarily have to, I saw that. They wouldn't necessarily have to do the review, but they at least have to.
I just want to jump in. Danette, do you have a question or comment, or do you just want to raise your hand?
She's volunteering.
Oh, no, I was raising my hand to review the facilities.
All right.
So what I was saying there is that that if we got somebody to volunteer, what I would see it as they're volunteering for is to kind of just manage that review. And they could obviously participate in it, but they would be the one to manage what facilities are we going to review, who's going to be part of that review team, and who's writing the report on it. And there are templates that we can use to do that. And the same thing with the contract. Somebody that would say, hey, I'll take contracts. I'll work with staff and figure out what these are, and I'll figure out which ones are kind of the short list of ones that we really should dig into, which to me, it's usually the big money ones. So if we get two people to do that, and then they can work with the board as a whole. Who wants to do a jail review? Who wants to go to boarding care? Who wants to, go to Semper Byron's? But anyway, they oversee it, and other people just pitch in and help. So that's what I'm hoping we can do with more people with energy to work on that. So I said the annual report. Well, anyway, and that's the nutshell. And you can look in the handbook and in the Welfare and Institution Code that sets up a local behavioral health board, which is what we are, when they describe what it is and how it's to be comprised and what its responsibility. There's about 15 things that are responsibility. I just hit the highlights. I may have missed a highlight. If I did, it's because it's in my head. So let's see here. So I'll talk about committees. So in the bylaws, it sets up the committees. We have set up committees. We could set up more standing committees. One of the requirements of the Brown Act is that standing committees, which are committees that are always there, or they're permanent, are subject to the Brown Act. So what that means to us is that when we have a committee meeting, we have to talk to Joe, we have to have, get ourselves an agenda, and most importantly, advertise it. And Joe takes care of that, but we have to work with him to tell him where it is, what time it is, all that kind of stuff. Under Zoom, it's maybe a little bit easier, but it's a little more difficult when we have to get a room and all that stuff. But that's the standing committee. And then you have the ad hoc committees, which are, we've talked a little bit about them, but they are meant to have a sunset. They're not permanent. They are set up to accomplish a task. And the best way to do it, Laura dug up I wrote a nice template that talks about what the task is, kind of lays the scope of that out, who's going to participate, when it's supposed to end, and I don't know what else. But anyway, that's if you're looking at starting an ad hoc, that's a good place to start. But they as I said, they're limited in time, but they could be 2 months, they could be 10 months. If that's how long the task takes, but you can't do that task and then jump into something else. And if you're really looking like you want to do that a lot, you want to change it to a standing committee, which requires a bylaw amendment. So, and the difference again, standing committee subject to the Brown Act, the ad hocs are not. So if they're a little bit more flexible and easy to put together in terms of, you know, the agenda and advertising and all that stuff. So let's say task oriented, they're not permanent. And one of the good things, this is sort of a editorial opinion. Our regular standing committees, which were executive committee, membership committee, child, family, youth, K committee, it's kind of by demographics largely, adults and older adults, AOD dual recovery. It didn't really work well. I mean, I think it has to do with passion and energy. The AOD dual recovery had some people that were really into it and they were productive. Other committees, you know, it's kind of a little patchy as far as how well they work. What really seems to have worked the best is ad hocs because of the passion, and they're pertinent in terms of time. They're being brought up because there's an issue in the community. My feeling is that we're better off doing our work there. And that is where the work of the board's supposed to happen. You know, we got 2 hours once a month. You know, we can tell this whole discussion we just had about timing that it's really not enough time to have any. Once in a while we have a good discussion. Usually there isn't time. So if you want to get stuff done and you want to discuss stuff, it's going to be in an ad hoc or a standing committee. Any questions so far? Comments?
Pauline, did you have a question? Oh, you're muted.
I was wondering how we get a hard copy of the bylaws so that we could review them at a deeper level.
Well, you should have it. It should be in your package. Have you gotten a package?
No, I haven't.
Joe, what's the deal there?
She hasn't been approved yet. It's not till the March meeting.
Okay.
She'll get a handbook when she gets approved.
Okay, but I mean, we could get you a copy of it now.
Not a problem as long as it's.
Yeah. And one thing I'll say is that Tim and I have been working with Emmy on an amendment of the bylaws, which actually has gotten, you know, we've put some time into it. But we did the last one in 2012, so it's been a while. That what really precipitated it was the AOD dual recovery committee said that's no longer term of art. We are now substance use disorders. And so they wanted to change the name. And so we said, well, we'll have to change the bylaws. And once we got into that, Tim will tell you, we're hitting a lot of different topics. But anyway, so there'll be a new ones. I'll just say, Emmy would cringe if she was here, but it'll probably be like 4 to 6 months from now. But I think we have it fleshed out pretty good now, but just between getting council to approve it and going to our board and then going to the board, it has to be approved by the board of supervisors. So anyway.
So we can get that to you right away, Colleen.
No problem. I probably should wait until I guess there's a formal approval.
Okay.
At least you know how how it's all set up.
Yes.
But anyway, so for an ad hoc to form an ad hoc, what you really need to do is bring it up to the chair and or bring it up to the full board. It could be a comment that there's an issue, maybe we need an ad hoc, but ultimately it either go to an executive committee meeting, which would be a good one, or just directly to Tim. The good thing about executive committee is if you bring it up and staff has an opportunity to, make some suggestions on scope. It's our call, but they often have good comments to make as far as, well, maybe we should do this and maybe you should ask so-and-so to participate. one of the things I wanted to say is on all these committees, both the standing committees and the ad hocs, it's not just board members. Really, it's intended to take advantage of experts in the community and experts on our staff. And you're free to ask them to participate. And in fact, you're encouraged to ask them to participate. And they usually are pretty good about it. And that's how we get really all the perspectives that we need for a lot of the issues that we're handling. So don't feel inhibited at all about or limited at all about asking folks. I only say no if they can't do it. But I think that's a good thing to discuss with others on the board or with staff as far as, okay, I want to do an ad hoc on blah, blah, blah. I'm thinking about first, when you do that, you ask people on the board who's interested. And as long as it's less than a quorum, well, I actually may not even matter. I'm not sure about that. But
You muted yourself.
thing pops up and tells you did that. But if you talk to other people on the board, other people on staff, and people in the community, just to get ideas on who would be great, good people to help on that effort. Once you've done that, just call them up and invite them. It's really the way they're going to work best.
Yeah.
So I think that covers the committees pretty good. And Tim said, you want me to talk about the Brown Act?
Yeah, but I just want to say something quickly. I think that's important. Standing committees, and it's been my experience, can't cover everything. So you can be one and focus on something. I joined a long time ago the adult ministry, and we had a meeting or two. We had 4 or 5 people saying, well, what is our scope? And it's huge. It's huge, and we couldn't do it. And so we chose, we're going to focus on, I think at that time, homelessness or housing issues. And then I went to the board and said, come and join the committee and help us focus on this. I also remember, correct me on this, Tim Ash, about Marian Pennekamp on the children's ministry. She focused on an issue and then got lots of people to participate with it. So that if you want to be on one of those standing committees and you want to have it ongoing and you want it to not be narrowly focused on something, that is one way to do it, is to make a committee by joining it and then saying, we're going to focus on this. And then you can spend lots of time and you can include different parts of that and don't have to say that focus. What are your thoughts on that, Tim?
Well, I agree. The thing about the ad hoc is it stops. So if you're interested in housing, it kind of logically falls into adults and older adults to me. I mean, that's one thing. Good time for ad hocs is sometimes it blurs over demographics because housing is really important for children. It's an issue of unhoused children. So sometimes an ad hoc might deal with something that goes over the demographics of our current standing committees. But as far as if you have some issue that isn't going away and you're not going to solve it or even come up with a recommendation in a short term, like an ad hoc, then you really want to do it under the umbrella of a standing committee because you can keep working on it. So, yeah, but you can focus because you can't cover it all. You're right. So you're going to focus or you're going to do nothing.
We have about 10 minutes left, and if everybody's okay with that, let's focus on the Brown Act. And Tim has looked at that a lot. I've asked him.
Really short.
Okay.
Okay. So the Brown Act, for those of you who don't know, is the California Open Meeting Act. And it's just basically a law that was enacted to get rid of smoke-filled backroom decision-making processes. So in a nutshell, we need training on it. And I think that's something that we should talk to Emmy about, because we have so many new people to have a training. Usually we've done it in the past with county council and ask for a training. They may have it online now. I'm not sure how they're doing it, but we need it. It's really important. This, what I'm doing right now, isn't training except for just a couple cautions between now and a training. One of the things that's included is the requirements for advertising the meetings, the shape and composition of the agendas, the level of detail, which we've been challenged on in the past, but that's in there. It's basically requires that meetings are public accessible. So I could have a Brown Act meeting in my house, but it would have to be accessible to folks who have issues with movement, that they can get into my house without going up the stairs, or they can make it up the stairs. I guess that's it. But anyway, I'm not planning on doing that. But the bottom line is that wherever you do it has to be accessible, and the public has to be allowed into it. And I know that in the past, when I was working for the state, there was issues with that, where people wanted to participate on, by television, and they weren't allowed to because of accessibility. There's a waiver in place for that right now because of COVID. So one of the big things for folks to remember is, again, is aimed at not having decision making happen out of the public view, is that we can't get together and discuss stuff unless it's a Brown Act meeting that's been advertised and agenda, all the things I. Go ahead,
Keep
Tim.
speaking up, sir.
Okay. So we cannot have discussions of more than two people on issues that are under the subject of the board, unless it's an advertised Brown Act legal meeting, and which means that Laura and Tim can sit down over a cup of coffee and talk for 10 hours about the jail. That's totally fine. No, 9 hours. And Allison and Tim and Laura could not sit down and have that same discussion. That would not be legal under the Brown Act. If they were doing it under the auspices of a ad hoc committee, they could, but just generally speaking, they can't. And the other thing I'll just mention it just because it's kind of odd and it's in there, is that there's no workarounds. You can't have what is called serial meetings, where Tim calls up Laura and says, we've got this agenda item coming up on Thursday, and we're going to be talking about this, and here's what I think about that, and here's why I really want this resolution. And then Laura calls up Allison and says, I was talking to Tim about this, and we have this meeting item coming up on Thursday, and Tim really would like to do this, and I kind of agree with that. And that's a serial meeting that's not legal under the Brown Act. It's not something that you would think of, but just sort of be advised. But really, that's it. We just have to have advertised, accessible meetings in public view. And so, there's obviously a lot more to it, but not much really critical. Some of it's just sort of little nuanced things that it'll generate questions. Well, how about this? And so, we can talk to Emmy and see if she can set up a training for staff to get the competent training.
Thank you.
That's all I got.
Thank you, Tim. Thank you very much. I just want to say one other thing. Alice, Joe, can you get these minutes out to us within a couple of days so that we kind of know what we talked about. We're bringing up different issues that might be important, like say, for the executive committee. So the sooner you can get out to us, that would be better. Can you do that, Joe?
I'll try.
Okay, thanks, Joe. Allison, I see your hand.
Sure. I just wanted to say that when I've worked on boards for the county before, they would bring county council to do a special training for the board, so they knew the rules. And they also had a really nice packet that was a little dated, but it was just like a, you know, a copy of something that went through the rules of the Brown Act that everybody could have access to. And that's something, I don't know if Joe is able to access county council and ask for that or not, but it's nice to have a hard copy.
Okay.
Is that in the handbook now, Joe? Do you know?
Yeah, it's
we
in the
do.
handbook, the Brown Act. Yeah, it's in there.
Several pages on it, yeah.
Yeah, so we have it. But also, Joe, while we're talking about the exec committee, could you put that on the exec committee agenda? Let us
I can't hear you.
Oh, sorry. Could you put on the executive committee agenda an item for Brown Act that will allow Tim and I to talk to Emmy about it, about the training?
Brown Act training.
Yeah.
Okay.
Thanks.
Right.
And just so you know, Cal BHB has,
Yeah, they have those too, right?
they have trainings. There's a very nice PowerPoint on Brown Act. And you can do a training through them. So
Online, yeah.
yeah, and they also do, and I know we're supposed to do every 2 years ethics. They have a ethics course that you can log in so that so everyone, it's recorded that you've done it. So we should just use that. It's a great resource.
Okay, thank you. We're close to the very end of the meeting, and I want to, it's been great discussion. It seems to me the last time we left about 20 minutes early, and so been vigorous and good. Are there any last things, comments or questions before we wrap up? Tim?
Yeah, I have a comment. When I talked earlier about some personal experiences and some real issues with both the criminal justice system and behavioral health in terms of support. And I just did want to say that in that time, you know, like 16 years, there's definitely been some improvements on some of those issues. I mean, that's a positive, you know, to me in the community. And I think there's plenty of room for more, but some good things have happened in the last 16 years on both of those systems.
Thank you, Tim. Other closing comments? Debbie and then Colleen.
Thank you. Years ago, NAMI locally had a training about advocacy, and the message that we were explained that if we use this messaging in our interactions with policymakers, that it would be a good thing. And it stuck with me. And I think one message that I like to think of myself was that particular one, which is simple. It's treatment works, because that has a lot to do with people's morale who are working in this area, that, you know, treatment makes a difference. And, you know, it says you make a difference because you're providing treatment. And so in other words, positive outcomes can occur. And people don't always hear about those. And so that's a good message to be giving to policymakers, just as an overall idea.
Thank you. Colleen.
I just wanted to say thank you very much. I just wanted to say thank you very much to everybody who's participated today. It's really been helpful.
Good. Thank you. Allison and then Bella. Allison, you had a closing comment? Or did your hand is still up from the past?
I am so bad about that. I'm really sorry, but I'll say thank you to everyone too.
Okay, thank you.
Sorry
Hey,
about
Bella, it's good to hear from you. What would you like to say closing?
Oh, thank you everybody for dealing with the technical difficulties of the day. I just wanted to say very briefly that I am, for some reason, because I'm going over my phone, I couldn't find how to unmute myself. So that's why I was only chatting, but I
Okay.
just figured it out. So, and I'm in my car because I don't have good internet in my house. It's a nightmare. Anyway, long story short, I would also be very interested, especially, working with Dawnette already. So I know she's currently in the process of getting on the board. And in the interim, if either of the Tims or Allison or whoever has information for my further education, so we can start getting together for that, the review and tours of the facilities. I'm very much interested in that as well. And I think that will be a wonderful project for myself, Dawnette, and anyone else who's interested, so that's exceedingly integral to the work I do. And I think it will just be an amazing opportunity for everyone involved.
Were you just volunteering to just oversee the facilities inspection process?
Yes, is that the formal title of that?
No.
Okay, I don't know. I mean, I've got a, oh, okay, well, whatever you call it.
I second that.
Okay, you've been elected already now.
We've got a lot of energy between the two of us, so touring and reviewing is definitely within our wheelhouse.
Well, you could co-chair an ad hoc that develops what we're going to look at, maybe a schedule, what the 2 facilities this year, 2 next, and ones that you're interested particularly, and just coordinate that.
Absolutely, and any guidance we can receive on that, at least to get on the ground and start running, send my way for sure.
Okay. Great, I'm really glad you're interested in that. We'll do. You bet. Everybody, it's been a great meeting. We've just time for us to wrap up. Thank you very much, and I guess I will officially adjourn this meeting and see you soon. Thank you. All right.